seizure disorders. Welcome to the section on anti-anxiety agents. Anti-anxiety agents include anxiolytics and minor tranquilizers. Anti-anxiety agents are instrumental in the treatment of anxiety, agitation, or tension. Anti-anxiety agents are able to reduce anxiety at doses which do not cause excessive sedation. Certain anti-anxiety agents may also be effective as anticonvulsants, muscle relaxants, or anesthesia adjuvants. Adrenergic beta antagonists are commonly used as the symptomatic treatment of anxiety. Substances with a benzodiazepine ring structures are widely used to treat anxiety and neurosis. Drugs in this class generally have sedative or weak hypnotic properties. Benzodiazepines may also be effective as muscle relaxants, anticonvulsants, and anesthesia adjuvants. Here's an overview of anti-anxiety agents. Alprazolam. Alprazolam is also available under the brand name Xanax. Alprazolam is an anti-anxiety agent used in the treatment of anxiety. Alprazolam also treats anxiety associated with depression with or without agoraphobia. It is available in tablet form. Side effects of alprazolam use include attention disturbance, blurred vision, changes in weight, clumsiness, constipation, decreased appetite, and decreased sex drive. Buspirone hydrochloride. Buspirone hydrochloride is also available under the brand name Buspar. It is a non-benzodiazepine anti-anxiety agent. Buspirone is used in the treatment of anxiety disorders. It is also used in short-term treatment to relieve the symptoms of anxiety due to motor tension, apprehension, autonomic hyperactivity, or hyperattentiveness. Side effects may include dizziness, sleep disturbance, dysphoria, noise intolerance, euphoria, depersonalization, hallucinations, suicidal ideation, seizures, depression, nonspecific chest pain, hypotension, abdominal distress, dry mouth, redness, itching of the eyes, eye pain, skin rash, numbness, urinary hesitancy or frequency, enuresis, amenorrhea, pelvic inflammatory disease, tinnitus, muscle aches or pains, headache, hyperventilation, hair loss, galactorrhea, decreased or increased libido, and delayed ejaculation. Clorazepate dipotassium. Clorazepate dipotassium is also available under the brand names Tranxene T and Tranxene SD. It is a benzodiazepine type of anti-anxiety agent and anticonvulsant. Clorazepate dipotassium is used in the treatment of anxiety, tension, and in cases of acute alcohol withdrawal. Clorazepate dipotassium may also be used as an adjunct in the treatment of seizures. Side effects of clorazepate dipotassium use include blurred vision, depression, difficulty in sleeping or falling asleep, dizziness, drowsiness, dry mouth, double vision, fatigue, and genital and urinary tract disorders. Diazepam. Diazepam is also available under the brand name Valium. Diazepam is an anti-anxiety agent, anticonvulsant, and skeletal muscle relaxant. Diazepam is used in the treatment of anxiety, tension, alcohol withdrawal, and status epilepticus. Diazepam may also be used as a muscle relaxant, a sedative in dentistry, and as an adjunct to treat seizure disorders. Side effects of diazepam use include blurred vision, dizziness, drowsiness, dry mouth, fatigue, headaches, and incoordination. The next drug is lorazepam. Lorazepam is also available under the brand name Ativan. Lorazepam is a benzodiazepine anti-anxiety agent. Lorazepam is used in the treatment of anxiety, tension, anxiety with depression, insomnia, and acute alcohol withdrawal symptoms. Lorazepam may also be used as an amnesic agent, anticonvulsant, anti-tremor drug, an adjunct to skeletal muscle relaxants, pre-anesthetic medication, as an adjunct to endoscopic procedures, and in the treatment of status epilepticus. Side effects of lorazepam use include clumsiness, dizziness, drowsiness, headache, lightheadedness, unsteadiness, and weakness. Meprobamate. Meprobamate is also available under the brand names Equinil, Miltown 200, 400, and 600. Meprobamate is a non-diazepine anti-anxiety agent. Meprobamate is used in the short-term treatment of anxiety. Side effects may include ataxia, drowsiness, dizziness, headache, paradoxical excitement, euphoria, slurred speech, diarrhea, visual disturbance, allergic reactions including hematologic and dermatologic symptoms, and paresthesias. Oxazepam. Oxazepam is also available under the brand name Serax. Oxazepam is a benzodiazepine anti-anxiety agent used in the treatment of anxiety, tension, and anxiety with depression. Oxazepam may also be used as an adjunct in the treatment of acute alcohol withdrawal. Side effects may include paradoxical reactions characterized by sleep disorders and hyperexcitability during the first weeks of therapy. Hypotension may occur after parenteral administration. Welcome to the section on antibiotics, antibacterials, anti-infectives, antihelminthics, and antifungals. Antibiotics, antibacterials, antifungals, and anti-infectives are drugs that are capable of killing infectious agents, including bacterial and fungal agents. These drugs can also prevent infectious agents from spreading and causing infection. Antihelminthics are drugs or agents which are destructive to worms. Antihelminthics are used to remove internal parasitic worms in both animals and humans. Imipenem-cilastatin sodium. Imipenem-cilastatin sodium is also available under the brand name Primaxin. Imipenem-cilastatin sodium is an antibiotic combined with an inhibitor of dehydropeptidase 1. Imipenem-cilastatin inhibits cell wall synthesis. It is also bactericidal against a wide range of gram-positive and gram-negative organisms. Imipenem-cilastatin sodium is also a bactericidal agent against a wide range of gram-positive and gram-negative organisms. It is also stable in the presence of beta-lactamase. Administered intravenously, it is used to treat the following serious infections: lower respiratory tract, urinary tract, gynecologic, skin and skin structures, bone and joint, endocarditis, intra-abdominal and bacterial septicemia. Imipenem-cilastatin also treats infections which are caused by more than one agent, as well as infections which are resistant to aminoglycosides, cephalosporins, or penicillins. Side effects of imipenem-cilastatin sodium include pseudomembranous colitis, nausea, diarrhea, hemorrhagic colitis, gastroenteritis, glossitis, pharyngeal pain, tongue papillary hypertrophy, hepatitis, jaundice, staining of the teeth or tongue, fever, confusion, seizures, encephalopathy, tremor, and psychic disturbances, as well as palpitations, rash, toxic epidermal necrolysis, and Stevens-Johnson syndrome. Sulbactam sodium. Sulbactam sodium is also called ampicillin sodium. Ampicillin sodium is also available under the brand name Unicin. It is an antibiotic penicillin used in the treatment of infections caused by beta-lactamase-producing bacteria. These infections produce strains of skin and skin structure infections caused by Staphylococcus aureus, Escherichia coli, Klebsiella species including Klebsiella pneumonia, Proteus mirabilis, Bacteroides fragilis, Enterobacteria species, and Acinetobacter chalcoceticus. Side effects of ampicillin use include pain and thrombophlebitis at the site of injection, diarrhea, abdominal distension, glossitis, fatigue, headache, dysuria, urinary retention, itching, chest pain, edema, facial swelling, erythema, chills, tightness in the throat, epistaxis or a nosebleed, substernal pain, mucosal bleeding, and candidiasis. Ciprofloxacin hydrochloride. Ciprofloxacin hydrochloride is also available under the brand name Cipro. It is a fluoroquinoline anti-infective which is effective against both gram-positive and gram-negative organisms. Systemically, ciprofloxacin hydrochloride is used in the treatment of urinary tract infections caused by Escherichia coli, Enterobacter cloaca, Citrobacter diversus, Citrobacter freundii, Klebsiella pneumonia, Proteus mirabilis, Providentia netgeri, Pseudomonas aeruginosa, Morganella morganii, Serratia marcescens, Serratia epidermidis, and Streptococcus faecalis. Ciprofloxacin hydrochloride is also used to treat uncomplicated cervical and urethral gonorrhea due to Neisseria gonorrhea, chancroid due to Haemophilus ducreyi, and uncomplicated or disseminated gonococcal infections. Ciprofloxacin is also useful in the treatment of mild to moderate chronic bacterial prostatitis due to E. coli or P. mirabilis, mild to moderate sinusitis due to strep pneumonia, H. influenza, or M. catarrhalis, and lower respiratory tract infections that are caused by E. coli, E. cloacae, K. pneumonia, P. mirabilis, P. aeruginosa, and Haemophilus influenza, as well as parainfluenza and Streptococcus pneumonia. Ciprofloxacin is often used in cases of bone and joint infections due to E. cloacae, P. aeruginosa, and S. marcescens, as well as skin and skin structure infections caused by E. coli, E. cloacae, Citrobacter freundii, M. morganii, K. pneumonia, P. aeruginosa, P. mirabilis, Proteus vulgaris, Providentia stewarti, Staphylococcus pyogenes, Staphylococcus epidermidis, and penicillinase and non-penicillinase producing strains of Staphylococcus aureus. Ophthalmically, ciprofloxacin is used to treat superficial ocular infections resulting from Staphylococcus and Streptococcus, E. coli, Haemophilus ducreyi, Haemophilus influenza, Haemophilus parainfluenza, Klebsiella pneumonia, Neisseria gonorrhea, and Proteus, Klebsiella, Acinetobacter calcocecus, Enterobacter aerogenes, Pseudomonas aeruginosa, Serratia marcescens, Chlamydia trachomatis vibrio, and Providentia species. Side effects of ciprofloxacin use may include abdominal pain, diarrhea, dry or painful mouth, intestinal perforation, anorexia, gastrointestinal bleeding, headache, fatigue, hallucinations, depersonalization, seizures, nephritis, hematuria, cylindruria, renal failure, urinary retention, polyuria, vaginitis, urethral bleeding, acidosis, rash, toxic epidermal necrolysis, Stevens-Johnson syndrome, superinfections, cholestatic jaundice, hearing loss, and dysphagia. Ophthalmic side effects may include blurred or disturbed vision, double vision, eye pain, and nystagmus. Norfloxacin. Norfloxacin is also available under the brand name Noroxin. Norfloxacin is a fluoroquinoline anti-infective. It inhibits bacterial DNA, making it active against gram-positive and gram-negative organisms. Norfloxacin is administered in tablets to treat uncomplicated urinary tract infections due to E. coli, K. pneumonia, or P. mirabilis. Superficial and acute ocular infections are treated with ophthalmic solution. Side effects of norfloxacin use include diarrhea, pseudomembranous colitis, stomatitis, headache, depression, insomnia, psychoses, decreased hematocrit, eosinophilia, leukopenia, neutropenia, toxic epidermal necrolysis, erythema, Stevens-Johnson syndrome, visual disturbances, hearing loss, hepatitis, pancreatitis, and arthralgia. In rare cases, myoclonus can be a side effect. Ofloxacin. Ofloxacin is also available under the brand name Floxin. Ofloxacin is a fluoroquinoline antibacterial and is effective against a wide range of gram-positive and gram-negative aerobic and anaerobic bacteria. Systemically, ofloxacin is used to treat pneumonia and acute bacterial exacerbations of chronic bronchitis or community-acquired pneumonia due to Haemophilus influenza or Streptococcus pneumonia. Ofloxacin is also used in cases of acute, uncomplicated urethral and cervical gonorrhea due to Neisseria gonorrhea. Ofloxacin is also used in instances of non-gonococcal urethritis and cervicitis due to Chlamydia trachomatis. Ophthalmically, ofloxacin may be used to treat conjunctivitis caused by Staph aureus, Staph epidermidis, S. pneumonia, Enterobacteria cloacae, Haemophilus influenza, Proteus mirabilis and Proteus aeruginosa. Side effects of ofloxacin use may include nausea, diarrhea, pseudomembranous colitis, dysgeusia, headache, seizures, sleep disorders, cognitive change, dream abnormality, hallucinations, and vertigo. Cardiovascular side effects may include chest pain, edema, hypertension, palpitations, or vasodilation. Meropenem. Meropenem is also available under the brand name Merim I-4. Meropenem is a broad-spectrum carbapenem antibiotic. It is used in cases of complicated appendicitis and peritonitis resulting from Escherichia coli, Klebsiella pneumonia, Pseudomonas aeruginosa, Bacterius fragilis, Bacteroides thetomicron, Peptostreptococcus species, and Viridans group Streptococci. Gastrointestinal side effects of meropenem may also include gastrointestinal hemorrhage, pseudomembranous colitis, abdominal pain, melena, oral moniliasis, jaundice, and ileus. Cardiovascular side effects may include heart failure, cardiac arrest, pulmonary embolus, tachycardia, hypertension, bradycardia, hypotension, and syncope. Respiratory side effects may include dyspnea. Cefoxidril. Cefoxidril monohydrate is also available under the brand name Duracef. It is a first-generation cephalosporin. It is used in the treatment of skin infections due to staphylococci or streptococci, as well as pharyngitis and tonsillitis resulting from group A beta hemolytic streptococci and urinary tract infections caused by Escherichia coli, Proteus mirabilis, and Klebsiella. There are no known side effects of cefadroxil use. However, its safety in children has not yet been determined. Cefazolin sodium. Cefazolin sodium is also available under the brand name Ancef. Cefazolin sodium is a first-generation cephalosporin. It is used in the treatment of endocarditis, septicemia, bone and joint infections due to Staph aureus, biliary tract infections due to E. coli and various strains of streptococci, Proteus mirabilis, Klebsiella and Staph aureus, and skin infections due to Staph aureus. Cefazolin sodium is also used to treat respiratory tract infections due to the presence of Streptococcus pneumonia, Klebsiella, Haemophilus influenza, and Staphylococcus aureus. When cefazolin is administered in high doses in patients suffering from renal failure, side effects may include confusion, tonic-clonic seizures, and mild hemiparesis. Cephalexin hydrochloride monohydrate. Cephalexin is also available under the brand name Keftab. Cephalexin is a first-generation cephalosporin used to treat respiratory tract infections caused by Streptococcus pneumonia and group A and B hemolytic streptococci. It is also used to treat bone infections caused by Proteus mirabilis or Staphylococcus, and otitis media due to strep pneumonia, Haemophilus influenza, Staphylococcus streptococci, and Neisseria catarrhalis. Side effects of cephalexin use may include nephrotoxicity or cholestatic jaundice. Cefaclor. Cefaclor is also available under the brand name Ceclor. It is a second-generation cephalosporin. Cefaclor is also used in the treatment of otitis media due to Streptococcus pneumonia, Haemophilus influenza, Streptococcus pyogenes, and Staphylococci, as well as lower respiratory tract infections due to strep pneumonia, Haemophilus influenza, and Strep pyogenes. Also, upper respiratory tract infections caused by Staph pyogenes, skin infections due to Staphylococcus aureus, and Staph pyogenes. Cefaclor is also used to treat urinary tract infections resulting from Escherichia coli, Proteus mirabilis, Klebsiella, and coagulase-negative staphylococci. Side effects of cefaclor use may include cholestatic jaundice and lymphocytosis. Sulfonicid sodium. Sulfonicid sodium is also available under the brand name Monosid. It is a second-generation cephalosporin. Sulfonicid is used in the treatment of lower respiratory tract infections, urinary tract infections, and infections of the bones, joints, skin, and skin structures. Sulfonicid is also useful in the treatment of septicemia and prophylaxis in colorectal surgery, vaginal hysterectomy, cholecystectomy, prosthetic arthroplasty, open heart surgery, and cesarean section. Side effects of sulfonicid use may include rash or hives, swelling of the face, throat, or lips, wheezing or trouble breathing, and severe diarrhea. Cefoxitin sodium. Cefoxitin sodium is also available under the brand name Mefoxin. Cefoxitin sodium is a second-generation broad-spectrum cephalosporin. It is both penicillinase and cephalosporinase resistant. Cefoxitin is stable in the presence of beta-lactamase. Administered intravenously, cefoxitin is used to treat lower respiratory tract infections such as pneumonia and abscesses, as well as urinary tract infections resulting from E. coli, Klebsiella species, Proteus mirabilis, Morganella morganii, Proteus vulgaris, and Providencia species. Cefotoxin sodium is also useful in cases of uncomplicated gonorrhea due to Neisseria gonorrhea and in the treatment of gynecological infections resulting from the presence of E. coli, Neisseria gonorrhea, and Bacteroides species. High doses of cefoxitin have been known to cause increased incidence of eosinophilia and increased AST levels in children over 3 months of age. Oral cefixime. Oral cefixime is also available under the brand name Suprax. Oral cefixime is a third-generation cephalosporin. Oral cefixime remains stable in the presence of beta-lactamase enzyme. It is used in the treatment of uncomplicated urinary tract infections caused by E. coli and P. mirabilis, and otitis media resulting from Haemophilus influenza, Moraxella catarrhalis, and Strep pyogenes. Oral cefixime is also useful in treating pharyngitis and tonsillitis that are caused by S. pyogenes and acute bronchitis and acute exacerbations of chronic bronchitis caused by strep pneumonia and Haemophilus influenza. Side effects of oral cefixime use may include flatulence, elevated alkaline phosphatase levels, and transient increases in BUN or creatinine. Cefoperazone sodium. Cefoperazone sodium is also available under the brand name Cefabid. It is a third-generation cephalosporin. It is used to treat respiratory tract infections due to strep pneumonia, Haemophilus influenza, Staphylococcus, Pseudomonas aeruginosa, Klebsiella pneumonia, Escherichia coli, Proteus mirabilis, and Enterococcus species. Cefoperazone sodium is also used to treat peritonitis and other intra-abdominal infections resulting from E. coli, P. aeruginosa or Enterococci, and bacterial septicemia due to strep pneumonia, S. agalacticae, Staph aureus, Enterococci, Pseudomonas aeruginosa, Escherichia coli, Klebsiella species, Proteus species, Clostridium species, and anaerobic gram-positive cocci. Cefoperazone is also useful in treating skin infections arising from the presence of Staph aureus, Staph pyogenes, Pseudomonas aeruginosa, and Enterococci, and pelvic inflammatory disease, endometritis, and other female genital tract infections resulting from Neisseria gonorrhea, Staph epidermidis, Staph agalacticae, E. coli, Clostridium species, and Enterococci. Side effects of cefoperazone use may include hypoprothrombonemia, bleeding, or bruising. Cefotaxime sodium. Cefotaxime sodium is also available under the brand name Clafuran. Cefotaxime sodium is a third-generation cephalosporin which is used in the treatment of GU tract infections and lower respiratory tract infections. Cefotaxime sodium is also used to treat infections of the skin, skin structures, bones, joints, and central nervous system. Cefotaxime is also useful in the treatment of intra-abdominal infections such as peritonitis, gynecologic septicemia, bacteremia, and prophylaxis in surgery. The next drug is Ceftazidine. Ceftazidine is also available under the brand name Tazidine. It is a third-generation cephalosporin which is used intravenously to treat lower respiratory tract infections, including pneumonia. These infections result from Pseudomonas species, Haemophilus, Klebsiella species, Enterobacter species, Proteus mirabilis, Escherichia coli, Serratia species, Citrobacter species, Streptococcus pneumonia, and Staphylococcus aureus. Ceftazidine is also used in the treatment of skin and skin structure infections including P. aeruginosa, Klebsiella species, E. coli, Proteus species, Enterobacter species, Serratia species, S. aureus, and S. pyogenes. Ceftazidine is also used to treat both complicated and uncomplicated urinary tract infections resulting from the presence of Pseudomonas aeruginosa, Enterobacteria species, Proteus species, Klebsiella species, and E. coli. Additionally, it is used to treat bacterial septicemia resulting from Pseudomonas aeruginosa, Klebsiella species, Haemophilus influenza, E. coli, Serratia species, S. pneumonia, and S. aureus. Ceftazidine is also used to treat infections of the bone and joint resulting from Pseudomonas aeruginosa, Klebsiella species, Enterobacter species, and Staph aureus. It is also used to treat GYN infections. The next drug is Ceftriaxon Sodium. Ceftriaxon Sodium is also available under the brand name Cefizox. Cefizox is a third-generation cephalosporin. It is used in the treatment of lower respiratory tract infections due to Streptococcus species, Klebsiella species, Proteus mirabilis, Escherichia coli, Haemophilus influenza, Staphylococcus aureus, Serratia species, Enterobacteria species, and Bacteroides species. Ceftriaxon Sodium is also used to treat urinary tract infections resulting from Staph aureus, E. coli, Pseudomonas species, P. mirabilis, P. vulgaris, Providentia redgari, Morganella morganii, Klebsiella species, Serratia species, and Enterobacter species. Ceftriaxon Sodium is also used to treat uncomplicated cervical and urethral gonorrhea due to Neisseria gonorrhea, the treatment of pelvic inflammatory disease due to Neisseria gonorrhea, E. coli, or S. agalacticae. Ceftriaxon Sodium is also used to treat intra-abdominal infections due to E. coli, S. epidermidis, Streptococcus species, Enterobacter species, Klebsiella species, Bacteroides species, and anaerobic cocci. Ceftriaxon Sodium is also used to treat septicemia due to Streptococcus species, Staph aureus, E. coli, Bacteroides species, Klebsiella species, and Serratia species. Ceftriaxon Sodium is also used to treat skin and skin structure infections resulting from Staph aureus, Staph epidermidis, E. coli, Klebsiella species, Streptococcus species, Proteus mirabilis, Serratia species, Enterobacter species, Bacteroides species, and anaerobic cocci. Ceftriaxon is also used in the treatment of infections of bones and joints resulting from Staph aureus, Streptococcus species, Proteus mirabilis, Bacteroides species, and anaerobic cocci. Ceftriaxon Sodium is also used to treat meningitis due to Haemophilus influenza and limited use for S. pyogenes. Side effects of ceftriaxone use may include transient increased levels of eosinophilia, AST, ALT, and CPK in children over 6 months of age. Ceftriaxon Sodium. Ceftriaxon Sodium is also available under the brand name Rocephin. Ceftriaxon Sodium is a third-generation cephalosporin. It is used in the treatment of lower respiratory tract infections due to Streptococcus pneumonia, Staphylococcus aureus, Haemophilus influenza, Haemophilus parainfluenza, Klebsiella pneumonia, Serratia marcescens, Escherichia coli, E. aerogenes, and Proteus mirabilis. Ceftriaxon Sodium is used in the treatment of skin and skin structure infections due to Staph aureus, Staph epidermidis, Staph pyogenes, Viridans group Streptococci, E. coli, Enterobacteria cloacae, K. oxytosa, K. pneumonia, P. mirabilis, Pseudomonas aeruginosa, Morganella morganii, Serratia marcescens, Acinetobacter chalcosaticus, Bacteroides fragilis, and Peptostreptococcus species. Ceftriaxon Sodium is also used in the treatment of both complicated and uncomplicated urinary tract infections resulting from E. coli, P. mirabilis, P. vulgaris, M. morganii, and K. pneumonia. Ceftriaxon Sodium is used in the treatment of uncomplicated cervical or urethral and rectal gonorrhea due to Neisseria gonorrhea. Ceftriaxon Sodium is used in the treatment of pharyngeal gonorrhea resulting from non-penicillinase-producing strains of Neisseria gonorrhea. Ceftriaxone is also useful in treating bacterial septicemia due to Staph aureus, strep pneumonia, E. coli, H. influenza, and K. pneumonia. Ceftriaxon Sodium is also used to treat infections of the bone and joint due to Staph aureus, strep pneumonia, E. coli, Proteus mirabilis, Klebsiella pneumonia, and Enterobacter species. It also is used to treat intra-abdominal infections resulting from E. coli, K. pneumonia, B. fragilis, Clostridium species, Peptostreptococcus species, and meningitis due to Haemophilus influenza, Neisseria meningitis, and strep pneumonia. Side effects may include an increase in serum creatinine, the presence of casts in the urine, and in rare cases the alteration of PT segments. Bacitracin. Bacitracin is an antibiotic produced by Bacillus subtilis and interferes with synthesis of cell wall. It prevents the incorporation of amino acids and nucleotides. Bacitracin is bactericidal, bacteriostatic, and active against protoplasts. Bacitracin is administered via ophthalmic and topical ointments. Bacitracin is used as a prophylaxis or treatment of infections in minor cuts, wounds, burns, and skin abrasions. It can also be used as treatment for superficial infections of the skin resulting from susceptible organisms. Ophthalmically, bacitracin is effective against species of Staph aureus, Streptococcus, Strep pneumonia, S. pyogenes, Corynebacterium, Neisseria, Neisseria gonorrhea, and beta-hemolytic streptococci. Topical side effects of bacitracin include allergic contact dermatitis and superinfection. Ophthalmic side effects include transient burning, stinging, itching, irritation, inflammation, angioneurotic edema, urticaria, and both vesicular and maculopapular dermatitis. Vancomycin hydrochloride. Vancomycin hydrochloride is also available under the brand name Vancomycin. Vancomycin hydrochloride is an antibiotic. It is believed to bind to the bacterial cell wall. Vancomycin hydrochloride arrests the synthesis of the cell wall and lyses the cytoplasmic membrane through a mechanism that is significantly different than that of penicillins and cephalosporins. Vancomycin is used to treat cases of antibiotic-induced pseudomembranous colitis resulting from Clostridium difficile. Vancomycin hydrochloride is also used as an effective treatment for Staphylococcus enterocolitis and severe or progressive antibiotic-induced diarrhea caused by C. difficile. Side effects of vancomycin use may include ototoxicity, which may lead to deafness. The deafness may continue to progress after vancomycin hydrochloride is discontinued. Other side effects include nephrotoxicity and red neck syndrome. Cardiovascular side effects of vancomycin use may include exaggerated hypotension, which may include shock and even cardiac arrest. Respiratory side effects of vancomycin use may include wheezing or dyspnea. Dermatologic side effects may include urticaria, pruritus, macular rashes, exfoliative dermatitis, Stevens-Johnson syndrome, toxic epidermal necrolysis, and vasculitis. The next drug is aztreonam for injection. Aztreonam for injection is a synthetic monobactam antibiotic. Aztreonam for injection is used to treat urinary tract infections resulting from Escherichia coli, Klebsiella pneumonia, Proteus mirabilis, Pseudomonas aeruginosa, Enterobacter cloacae, Klebsiella oxytosa, Citrobacter species, and Serratia marcescens. Aztreonam for injections is also used to treat lower respiratory infections due to E. coli, K. pneumonia, P. aeruginosa, Haemophilus influenza, Proteus mirabilis, Enterobacter species, and Serratia marcescens septicemia due to E. coli, K. pneumonia, P. aeruginosa, P. mirabilis, S. marcescens, and Enterobacter species. It is also used to treat both skin and skin structure infection caused by E. coli, P. mirabilis, S. marcescens, Enterobacter species, Pseudomonas aeruginosa, Klebsiella pneumonia, and Citrobacter species. Aztreonam for injection is also useful in treating intra-abdominal infections resulting from E. coli, Klebsiella species including Klebsiella pneumonia, Enterobacter species including E. cloacae, P. aeruginosa, Citrobacter species, including C. freundii, and Serratia species, including S. marcescens, and gynecological infections due to E. coli, K. pneumonia, P. mirabilis, and Enterobacter species, including E. cloacae. Serious side effects may include Clostridium difficile-associated diarrhea, gastrointestinal bleeding, seizures, anemia, neutropenia, thrombocytopenia, leukocytosis, thrombocytosis, pancytopenia, and eosinophilia. Penicillin G benzathine. Penicillin G benzathine is used intramuscularly. It is also available under the brand name Permapen. Intramuscular penicillin G benzathine is a penicillin antibiotic. Intramuscular penicillin G benzathine is used in the treatment of infections due to penicillin G sensitive microorganisms susceptible to low and prolonged serum levels. Intramuscular penicillin G benzathine can also be used to treat cases of mild to moderate URTI resulting from susceptible streptococci. Side effects of penicillin G may include black or hairy tongue, exaggerated reflexes, mild diarrhea, nausea or vomiting, pain, swelling, redness at the injection site, and twitching. Penicillin G procaine. Penicillin G procaine is also used intramuscularly. Penicillin G procaine is also available under the brand name Aercillin. Penicillin G procaine is a penicillin antibiotic used in cases of penicillin-sensitive staphylococci, pneumococci, streptococci, and bacterial endocarditis. Penicillin G procaine is also effective in the treatment of gonorrhea and all stages of syphilis. Side effects of penicillin G may include black or hairy tongue, exaggerated reflexes, mild diarrhea, nausea or vomiting, pain, swelling, or redness at the injection site, and twitching. Penicillin V potassium. Penicillin V potassium is an antibiotic and used in the treatment of cases of mild to moderate upper respiratory tract streptococcal infections such as scarlet fever and erysipelas. It is also an effective treatment for mild to moderate upper respiratory tract pneumococcal infections such as otitis media and mild staphylococcal infections of the skin and soft tissue. Penicillin V potassium can also be used to treat mild to moderate fusospiroketosis, also called Vincent's infection of the oropharynx. Side effects of penicillin V may include black hairy tongue, irritation of the mouth or throat, mild diarrhea, nausea, upset stomach, and vomiting. Amoxicillin. Amoxicillin is also available under the brand names Amoxil and Polymox. Amoxicillin is an antibiotic. Amoxicillin is used to treat gram-positive streptococcal infections including Streptococcus faecalis, strep pneumonia, and non-penicillinase-producing staphylococci. Amoxicillin is also used to treat gram-negative infections resulting from Haemophilus influenza, Proteus mirabilis, Escherichia coli, and Neisseria gonorrhea. Side effects of amoxicillin use may include diarrhea, dizziness, irritation of the mouth or throat, nausea, and vomiting. Ampicillin. Ampicillin is an oral medication. It is also available under the brand names Omnipen, Polycillin, and Principen. Oral ampicillin is a synthetic broad-spectrum antibiotic suitable for gram-negative bacteria. Oral ampicillin is used in the treatment of infections of the respiratory, gastrointestinal, and GU tracts caused by Shigella, Salmonella, Escherichia coli, Haemophilus influenza, Proteus strains, Neisseria gonorrhea, Neisseria meningitis, and Enterococcus. Oral ampicillin may also be used to treat cases of otitis media in children, as well as bronchitis, rat bite fever, and whooping cough. Side effects of ampicillin use may include inflammation and redness of the tongue, irritation of mouth or throat, mild diarrhea, nausea, secondary infection, and vomiting. Carbenicillin indonyl sodium. Carbenicillin is also available under the brand name Geocillin. Carbenicillin indonyl sodium is a penicillin antibiotic used in the treatment of both upper and lower urinary tract infections resulting from Escherichia coli, Proteus vulgaris, and Proteus mirabilis, as well as Morganella morganii, Providencia retgeri, Enterobacter, Pseudomonas, and Enterococci. Carbenicillin indonyl sodium is also used in treating prostatitis due to E. coli, Streptococcus faecalis, P. mirabilis, and Enterobacter species. Neurotoxicity is a known side effect in patients with impaired renal function. Meslocillin sodium. Meslocillin sodium is also available under the brand name Meslin. Meslocillin sodium is a broad-spectrum antibiotic which is used parenterally. Meslocillin is used to treat lower respiratory tract infections resulting from Haemophilus influenza, Klebsiella pneumonia, Proteus mirabilis, Pseudomonas aeruginosa, E. coli, and Bacteroides fragilis. Meslocillin sodium is used to treat intra-abdominal infections resulting from E. coli, P. mirabilis, Klebsiella species, Pseudomonas, Streptococcus faecalis, Bacteroides, Peptococcus, and Peptostreptococcus. Meslocillin sodium is also used in the treatment of urinary tract infections due to E. coli, P. mirabilis, Proteus, Morganella morganii, Klebsiella, Enterobacter, Serratia, Pseudomonas, and Strep faecalis. Meslocillin can also be used to treat cases of uncomplicated gonorrhea due to Neisseria gonorrhea and gynecological infections resulting from Neisseria gonorrhea, Peptococcus, Peptostreptococcus, Bacteroides, E. coli, P. mirabilis, Klebsiella, and Enterobacter. Meslocillin sodium is used to treat skin and skin structure infections due to S. faecalis, E. coli, P. mirabilis, indole-positive Proteus, Proteus vulgaris, Providencia retgeri, Klebsiella, Enterobacter, Pseudomonas, Peptococcus, and Bacteroides. Bleeding abnormalities and decreased hemoglobin or hematocrit values are known side effects of meslocillin use. Piperacillin sodium. Piperacillin sodium is also available under the brand name Piperacil. Piperacillin sodium is a semisynthetic broad-spectrum penicillin for parenteral use. Piperacillin is an antibiotic used in the treatment of intra-abdominal infections, gynecological infections, septicemia, lower respiratory tract infections, skin and skin structure infections, bone and joint infections, and uncomplicated gonococcal urethritis. Piperacillin sodium is also used to treat infections due to Streptococcus species and prophylaxis in surgery. A rare side effect of piperacillin use is prolonged muscle relaxation. Ticarcillin disodium. Ticarcillin disodium is also available under the brand name Ticar. Ticarcillin disodium is a parenteral semisynthetic antibiotic. It has an antibacterial spectrum of activity resembling that of carbenicillin. Ticarcillin is primarily used in the treatment of gram-negative organisms. Ticarcillin disodium is also effective for mixed infections. Side effects of ticarcillin use include neurotoxicity and neuromuscular excitability, particularly in patients with impaired renal function. Cloxacillin sodium. Cloxacillin sodium is an antibiotic used in the treatment of infections caused by penicillinase-producing staphylococci. Side effects of cloxacillin use may include mild nausea, vomiting, diarrhea, and abdominal pain. Dicloxacillin sodium. Dicloxacillin sodium is also available under the brand name Dynapen. Dicloxacillin sodium is an antibiotic used in the treatment of infections resulting from penicillinase-producing staphylococci. Dicloxacillin sodium may also be used to initiate therapy in any suspected staphylococcal infection. Side effects of dicloxacillin may include diarrhea, fever, gas, general body discomfort, heartburn, joint pain, muscle aches, nausea, secondary infection, stomach pain, and vomiting. The next drug is nafcillin sodium. Nafcillin sodium is also available under the brand name Unipen. Nafcillin sodium is an antibiotic used in treating penicillinase-producing staphylococci infections. Nafcillin sodium is also used as initial therapy in cases where staphylococcal infection is suspected until the results of the culture have been obtained. Sterile abscesses and thrombophlebitis are known side effects of nafcillin. These side effects may frequently occur in the elderly. Oxacillin sodium. Oxacillin sodium is also available under the brand name Bactocil. Oxacillin sodium is an antibiotic used in the treatment of infections caused by penicillinase-producing staphylococci. Oxacillin sodium may also be used to initiate therapy in cases where staphylococcal infections is suspected. Trimethoxate glucuronate. Trimethoxate glucuronate is also available under the brand name Nutrexin. Trimethoxate glucuronate is an anti-infective. It inhibits the enzyme dihydrofolate reductase, resulting in interference with thymidylate biosynthesis and inhibition of folate-dependent formal transferases. This leads to inhibition of purine synthesis and disruption of DNA, RNA, and protein synthesis, and ultimately cell death. Trimethoxate must be given with leucovorin to prevent serious or life-threatening complications, including bone marrow suppression, oral and gastrointestinal mucosal ulceration, and renal and hepatic dysfunction. Trimethoxate is used as an alternative therapy with concurrent leucovorin for the treatment of moderate to severe cases of pneumocystis carinii pneumonia in immunocompromised patients. Trimethoxate glucuronate is also used in the treatment of non-small cell lung, prostate, or colorectal cancer. Side effects of trimethoxate use include neutropenia, thrombocytopenia, anemia, and hepatic toxicity. These side effects are manifested by increased ALT, AST, alkaline phosphatase, and bilirubin, increased serum creatinine, hyponatremia, and hypocalcemia. Chloramphenicol. Chloramphenicol is also available under the brand name chloromycetin. Chloramphenicol is an anti-infective. It interferes with or inhibits protein synthesis in bacteria by binding to 50S ribosomal subunits. Chloramphenicol is used in the treatment of typhoid fever, but not for the typhoid carrier state. Chloramphenicol is used to treat serious infections caused by salmonella, rickettsia, chlamydia, and lymphogranuloma psittacosis group. Chloramphenicol should not be used for trivial infections, for prophylaxis of bacterial infections, or to treat minor infections such as cold, flu, or throat infections. Serious side effects of chloramphenicol use include aplastic anemia, hypoplastic anemia, thrombocytopenia, granulocytopenia, hemolytic anemia, pancytopenia, and hemoglobinuria. Clindamycin hydrochloride. Clindamycin is also available under the brand name Clindamycin. Clindamycin is a clindamycin and lincomycin antibiotic. It is both bacteriostatic and bactericidal. Clindamycin suppresses protein synthesis by microorganisms by binding to ribosomes and preventing peptide bond formation. It is used to treat serious respiratory tract infections, serious skin and soft tissue infections, septicemia, intra-abdominal infections, and infections of the female pelvis and genital tract. Side effects of clindamycin use may include diarrhea, pseudomembranous colitis, abdominal pain, esophagitis, unpleasant or metallic taste after high IV doses, glossitis, stomatitis, hypotension, morbilliform rash, skin rashes, urticaria, erythema multiforme, angioneurotic edema, leukopenia, Stevens-Johnson-like syndrome, thrombocytopenia, transient eosinophilia, agranulocytosis, aplastic anemia, jaundice, renal dysfunction, vaginitis, superinfection, tinnitus, and polyarthritis. Spectinomycin hydrochloride. Spectinomycin hydrochloride is also available under the brand name Trobicin. It is an antibiotic produced by Streptomyces spectabilis. Spectinomycin hydrochloride inhibits bacterial protein synthesis by binding to ribosomes. This interferes with the transmission of genetic information crucial to the life of the microorganism. Spectinomycin is used in the treatment of acute gonorrheal proctitis and urethritis in men and acute gonorrheal cervicitis and proctitis in women. A single dose of spectinomycin has caused the following side effects: soreness at the site of injection, urticaria, dizziness, chills, nausea, fever, and insomnia. Multiple doses have caused a decrease in H&H and CCR and an increase in alkaline phosphatase, BUN, and ALT. In single or multiple doses, a decrease in urine output is not uncommon. Azithromycin. Azithromycin is also available under the brand name Zithromax and Azicite. It is a macrolide antibiotic derived from erythromycin. Azithromycin acts by binding to the P site of the 50S ribosomal subunit and inhibiting the RNA-dependent protein synthesis. Azithromycin stimulates the dissociation of peptidyl T RNA from ribosomes. Azithromycin is used in the treatment of acute bacterial exacerbations of COPD due to Haemophilus influenza, Moraxella catarrhalis, or Streptococcus pneumonia. Azithromycin is also used as an alternative to first-line therapy to treat streptococcal pharyngitis or tonsillitis due to Streptococcus pyogenes. Azithromycin is available in oral suspension and tablet form. It may also be administered intravenously. Azicite is a topical ophthalmic solution of azithromycin formulated in Duracite, which consists of polycarbophil, EDTA sodium, and sodium chloride. Side effects of azithromycin use may include diarrhea, abdominal pain, melena, mucositis, cholestatic jaundice, pseudomembranous colitis, dizziness, headache, chest pain or palpitations, ventricular arrhythmias, rash, anaphylaxis, leukopenia, neutropenia, decreased platelet count, superinfection, and bronchospasm. Clarithromycin. Clarithromycin is also available under the brand name Biaxin. Clarithromycin is a macrolide antibiotic which binds to the 50S ribosomal subunit of susceptible organisms. It interferes or inhibits microbial protein synthesis. Clarithromycin treats mild to moderate infections caused by susceptible strains of pharyngitis or tonsillitis due to Streptococcus pyogenes, acute maxillary sinusitis or acute bacterial exacerbation of chronic bronchitis due to Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, pneumonia due to Mycoplasma pneumonia, S. pneumonia, or chlamydia pneumonia. Clarithromycin is also used to treat uncomplicated skin and skin structure infections due to Staphylococcus aureus or Staph pyogenes and disseminated mycobacterial infections due to Mycobacterium avium. Gastrointestinal side effects of clarithromycin use may include abdominal discomfort or pain, pseudomembranous colitis, glossitis, stomatitis, oral monoliasis, and vomiting. Central nervous system side effects may include behavioral changes, depersonalization, and hallucinations. Other side effects may include mild skin eruptions and, in rare cases, anaphylaxis and Stevens-Johnson syndrome. Erythromycin estolate. Erythromycin is also available under the brand name Ilosone. Erythromycin is an antibiotic which is the most active form of erythromycin. It has a long-lasting activity. Doxycycline calcium. Doxycycline is a tetracycline antibiotic and is used in treating infections outside the urinary tract for patients with impaired renal function. Minocycline hydrochloride. Minocycline hydrochloride is also available under the brand name Minicin. It is a tetracycline antibiotic and is used primarily to eliminate meningococci from the nasopharynx of asymptomatic Neisseria meningitis carriers, and in cases where the risk of meningococcal meningitis is high. Side effects of minocycline may include blue-gray pigmentation areas of cutaneous inflammation, vertigo, ataxia, drowsiness, and in rare cases Stevens-Johnson syndrome. The next drug is tetracycline hydrochloride. Tetracycline hydrochloride is a tetracycline antibiotic and is used primarily as part of combination therapy to eradicate H. pylori infections. Side effects of tetracycline use may include oral candidiasis, glossitis, staining of the tongue, severe gingival hyperplasia, pain, and hypersensitivity reactions. Amikacin sulfate. Amikacin sulfate is also available under the brand name Amikin. It is an aminoglycoside antibiotic derived from kanamycin. Amikacin sulfate is effective against both penicillinase and non-penicillinase-producing organisms. Amikacin sulfate is primarily used in the short-term treatment of gram-negative bacterial infections such as Pseudomonas, Escherichia coli, Proteus, Providencia, Klebsiella, Enterobacter, Serratia, and Acinetobacter. Amikacin sulfate may also be used to treat infections due to gentamicin or tobramycin-resistant strains of Providencia redgeri, P. stewarti, Serratia marcescens, and Pseudomonas aeruginosa. Gentamicin sulfate, which is also available under the brand name garamycin. It is an aminoglycoside antibiotic and is used to treat serious infections caused by Pseudomonas aeruginosa, Proteus, Klebsiella, Enterobacter, Serratia, Citrobacter, and Staphylococcus. Gentamicin sulfate is also used in the treatment of ophthalmic infections due to Staphylococcus, such as Staph aureus, Streptococcus pneumonia, beta-hemolytic streptococci, Corynebacterium species, Streptococcus pyogenes, Escherichia coli, Haemophilus influenza, Haemophilus aegyptus, Haemophilus ducreyi, Klebsiella pneumonia, Neisseria gonorrhea, Proteus species, Acinetobacter chalcocetus, Enterobacter aerogenes, Pseudomonas aeruginosa, Serratia marcescens, and Moraxella lacunata. Side effects of gentamicin include seizures, increased blood pressure, alopecia, purpura, and pseudotumors cerebri. Side effects after ophthalmic use include transient irritation, angioneurotic edema, urticaria, vesicular and maculopapular dermatitis, mydriasis, conjunctival paresthesia or hyperemia, and bacterial or fungal corneal ulcers. Kanamycin sulfate. Kanamycin sulfate is also available under the brand name Cantrex. It is an aminoglycoside antibiotic and tertiary antitubercular agent. Kanamycin sulfate is used in the initial therapy for infections due to Escherichia coli, Proteus, Enterobacter aerogenes, Klebsiella pneumonia, Serratia marcescens, and Acinetobacter. Side effect of kanamycin use may include sprue-like syndrome with steatorrhea, malabsorption, and electrolyte imbalance. Neomycin sulfate. Neomycin sulfate is also available under the brand name Misafredin sulfate. Neomycin sulfate is an aminoglycoside antibiotic and is used as a treatment in cases of hepatic coma and sterilization of the gut prior to surgery. Neomycin sulfate is also used in inhibition of ammonia-forming bacteria in gastrointestinal tract and in hepatic encephalopathy. Neomycin sulfate can also be used as prophylaxis or treatment of infection in burns, minor cuts, wounds, and skin abrasions. Side effects of neomycin may include ototoxicity, nephrotoxicity, sprue-like syndrome, and skin rashes after topical or parenteral administration. Tobramycin sulfate. Tobramycin sulfate is also available under the brand name Nebsin. Tobramycin sulfate is an aminoglycoside antibiotic. Tobramycin sulfate is used to treat cases of complicated and recurrent urinary tract infections due to Pseudomonas aeruginosa, Proteus, Escherichia coli, Klebsiella, Enterobacter, Serratia, Staphylococcus aureus, Citrobacter, and Providencia. It is also used to treat cases of lower respiratory tract infections due to P. aeruginosa, Klebsiella, Enterobacter, E. coli, Serratia, and S. aureus. Tobramycin sulfate is also used to treat intra-abdominal infections, skin, bone, and skin structure infections due to Pseudomonas aeruginosa, Proteus, E. coli, Klebsiella, Enterobacter, and S. aureus, as well as serious central nervous system infections. Ophthalmic side effects of tobramycin use may include transient irritation, angioneurotic edema, urticaria, and vesicular or maculopapular dermatitis. Streptomycin sulfate. Streptomycin is an aminoglycoside antibiotic. It is used with other drugs to treat Mycobacterium tuberculosis infections. Streptomycin is administered intramuscularly. Welcome to the sections on anticholinergics. Anticholinergics are agents which are used to block the parasympathetic nerves or to annul or antagonize the effects of the parasympathetic nervous system. Anticholinergics work by blocking certain nerve impulses, preventing certain muscle contractions, and causing gland secretions within the body. Here's an overview of anticholinergics. Edrophonium chloride. Edrophonium is also available under the brand name Enlon and Tensilon. Edrophonium is an indirect-acting cholinesterase inhibitor. It is used to increase the duration of action at the motor end plate Edrophonium also causes a transient increase in muscle strength in patients suffering from myasthenia gravis. It is used primarily as a diagnostic tool to determine the requirements for treating patients with myasthenia gravis. It is also used as an adjunct in treating respiratory depression. Neostigmine bromide. Neostigmine is an indirect-acting cholinergic acetylcholinesterase inhibitor. Neostigmine induces an increase in the concentration of acetylcholine at the myoneural junction. This facilitates transmission of impulses across the myoneural junction. In cases of myasthenia gravis, this will increase muscle strength. Neostigmine is used in the treatment and diagnosis of myasthenia gravis. Neostigmine is an antidote for tubocurarine and other non-depolarizing drugs and is used in treatment and prophylaxis of postoperative distension or urinary retention. Serious side effects may include fecal incontinence, excessive salivation, dysphagia, increased gastric secretion, tachycardia, hypotension, ECG changes, nodal rhythm, cardiac arrest, syncope, substernal pain, anaphylaxis, and urticaria. Physostigmine salicylate. Physostigmine is also available under the brand name Antilyrium. Physostigmine is an indirect-acting cholinergic acetylcholinesterase inhibitor. It causes an increased concentration of acetylcholine at the nerve endings and antagonizes anticholinergic drugs. In this way, physostigmine produces miosis, increased accommodation, and a decrease in intraocular pressure with decreased resistance to outflow of aqueous humor. Physostigmine is useful in the treatment of cases of overdose due to cholinergic blocking drugs such as atropine and tricyclic antidepressants. The side effects of physostigmine use include nausea, gastrointestinal discomfort, diarrhea, hypotension, bronchial constriction, and increased salivation. Pyridostigmine bromide. Pyridostigmine bromide is also available under the brand name Mestinon. Pyridostigmine bromide is an indirect-acting cholinergic acetylcholinesterase inhibitor. It has a slower onset, longer duration of action, and fewer side effects than neostigmine. It's used in the treatment of myasthenia gravis and is an antidote for non-depolarizing muscle relaxants such as tubocurarine. Skin rash is one side effect of pyridostigmine bromide, and thrombophlebitis may occur following intravenous use. Atropine sulfate. Atropine sulfate is also available under the brand name Atropare. Atropine sulfate is a cholinergic blocking agent. It blocks the action of acetylcholine on postganglionic cholinergic receptors in smooth muscle, cardiac muscle, exocrine glands, urinary bladder, and the AV and SA nodes of the heart. Used ophthalmologically, atropine blocks the effect of acetylcholine on the sphincter muscle of the iris and the accommodative muscle of the ciliary body, resulting in dilation of the pupil and paralysis of the muscles required to accommodate for close vision. Atropine is used as an adjunct in peptic ulcer treatment, irritable bowel syndrome, and in the treatment of spastic disorders of the biliary tract. Atropine has both parenteral and ophthalmological use. Parenterally, atropine sulfate is used as an antiarrhythmic. Ophthalmologically, it is used in cases of acute inflammation of the iris and uveal tract. Ophthalmologic side effects of atropine use can include blurred vision, increased intraocular pressure, and dermatitis. Long-term use may cause irritation, photophobia, eczematoid dermatitis, conjunctivitis, hyperemia, or edema. Scopolamine hydrobromide. Scopolamine is also available under the brand name Hyoscine. Scopolamine is an anticholinergic antiemetic drug with central nervous system depressant effects. Scopolamine causes pupillary dilation and paralysis of the muscles of accommodation. This enables the physician to examine the inner structure of the eye. Scopolamine is used in the control of cycloplegia and mydriasis during diagnostic procedures. Scopolamine is also used both preoperatively and postoperatively in the treatment of iridocyclitis and to dilate the pupil of the eye when treating uveitis and posterior synechii. Side effects of scopolamine use include disorientation, delirium, decreased respiratory rate, blurred vision, and increased intraocular pressure. Ipratronium bromide. Ipratropium bromide is also available under the brand name Atrovent. It is an anticholinergic quaternary ammonium compound. Ipratropium bromide antagonizes the action of acetylcholine and prevents the increase in intracellular levels of cyclic guanosine monophosphate, which leads to bronchodilation. Ipratropium bromide is used in the treatment of chronic bronchitis and emphysema and for the symptomatic relief of rhinorrhea. Side effects of inhalation aerosol may include cough, dizziness, headache, fatigue, dryness of the oropharynx, gastrointestinal distress, heart palpitation, tachycardia, hives, alopecia, difficulty in accommodation, drying of secretions, urinary difficulty, paresthesias, and mucosal ulcers. Side effects included with ipratropium bromide inhalation solution include dizziness, insomnia, nervousness, tremor, headache, dry mouth, nausea, constipation, hypertension, tachycardia, heart palpitations, flu-like symptoms, back or chest pain, and arthritis. Propantylene bromide. Propantylene bromide is also available under the brand name probanthine. It is an anticholinergic and quaternary ammonium compound. It is used as an antispasmodic. It is used in cases of spastic and inflammatory disease of the gastrointestinal and urinary tract and for the control of salivation and enuresis. Propantylene bromide is also used as an adjunct in peptic ulcer therapy. Welcome to the section on anticoagulants and thrombolytic agents. Anticoagulants are drugs or agents which are used to prevent blood clotting by inhibiting the progression of fibrinogenesis. Thrombolytic agents are medications that dissolve blood clots. A blood clot is characterized as the conversion of blood from a liquid form to solid through the process of coagulation. A thrombus is a blood clot which forms inside of a blood vessel. If the thrombus moves away from its original site, it is referred to as an embolus or an embolism. Anticoagulants are usually administered to patients with myocardial infarction, venous thrombosis, peripheral arterial emboli, and pulmonary emboli. Anticoagulants have been used to prevent transient ischemic attacks. Anticoagulants are also used to reduce the risk of recurrent myocardial infarction. Here are the three mechanisms of action for anticoagulants. 1. The activation of anti-clotting factors, especially antithrombin 3. 2. The inhibition of synthesis of blood coagulation factors. 3. Direct inhibition of thrombin. Here's an overview of anticoagulants and thrombolytic agents. Anistraplase. Anistraplase is also available under the brand name Eminase. Anistraplase is a thrombolytic enzyme used in the management of acute myocardial infarction in adults. It is also used in the improvement of ventricular function and reduction of mortality. Side effects may include bleeding, hematuria, hemoptysis, gastrointestinal hemorrhage, intracranial bleeding, gum or mouth hemorrhage, epistaxis, anemia, eye hemorrhage, arrhythmias, hypotension, cardiac rupture, chest pain, and emboli. Streptokinase. Streptokinase is also available under the brand name cabicinase. Streptokinase is a thrombolytic agent. It is used as a treatment in cases of deep vein thrombosis, arterial thrombosis and embolism, acute evolving transmural myocardial infarction, and pulmonary embolism. Streptokinase is also used in the clearing of occluded arteriovenous and intravenous cannulae. Side effects may include superficial bleeding, severe internal bleeding, fever, the possible development of Guillain-Barré syndrome, or the development of anti-streptokinase antibodies. Urokinase. Urokinase is also available under the brand name abokinase. Urokinase is a thrombolytic agent. It is used in cases of acute pulmonary thromboembolism and coronary artery thrombosis. Urokinase is also used to clear IV catheters that are blocked by fibrin or clotted blood. Urokinase is administered through intravenous infusion. Side effects may include superficial bleeding, severe internal bleeding, transient hypotension or hypertension, and tachycardia. Heparin Calcium. Heparin is also available under the brand name Calcillion. Heparin is an anticoagulant. It is used in the treatment of pulmonary embolism, peripheral arterial embolism, prophylaxis, and venous thrombosis. Side effects of heparin use may include hemorrhage, thrombocytopenia, chills, fever, urticaria, and in rare cases, asthma, lacrimation, and headache. Warfarin sodium. Warfarin sodium is also available under the brand name Coumadin. Warfarin sodium is an anticoagulant. It is used in the prophylaxis and treatment of venous thrombosis, atrial fibrillation, pulmonary embolism, and thromboembolic complications associated with atrial fibrillation. Hemorrhage is the most common side effect of warfarin use. Hemorrhage may also occur in any tissue or organ. Dipyridamole. Dipyridamole is also available under the brand name Persantine. Dipyridamole is a platelet adhesion inhibitor. It is used as an adjunct to Coumadin in preventing postoperative thromboembolic complications of cardiac valve replacement. Side effects may include gastrointestinal intolerance, diarrhea, dizziness, headache, syncope, peripheral vasodilation, flushing, and in rare cases angina pectoris or aggravation of angina pectoris. Ticlopidine hydrochloride. Ticlopidine hydrochloride is also available under the brand name Ticlid. Ticlopidine hydrochloride is used to reduce the risk of thrombotic stroke in patients who have impending stroke who have had a thrombotic stroke. Side effects of ticlopidine hydrochloride may include neutropenia, agranulocytosis, thrombotic thrombocytopenia purpura, pancytopenia, immune thrombocytopenia, hemolytic anemia with reticulocytosis, diarrhea, hepatitis, cholestatic or hepatocellular jaundice, hepatic necrosis, ecchymoses, hematuria, epistaxis, conjunctival hemorrhage, gastrointestinal or perioperative bleeding, post-traumatic bleeding, and in rare cases, intracerebral bleeding. Welcome to the section on anticonvulsants. Anticonvulsants are drugs which are used to prevent or reduce the severity of seizures. Seizures are defined as attacks of cerebral origin consisting of sudden and transitory abnormal phenomena of a motor, sensory, autonomic, or psychic nature resulting from transient dysfunction of the brain. Signals passing from one part of the brain to the other involve the movement of electrically charged substances called ions in and out of cells. Many anticonvulsants act by affecting the movement of ions through specific channels in the nerve cells. This tends to normalize the electrical activity of the brain. Important ions in this regard include sodium, calcium, chloride, and potassium. GABA, also called gamma-aminobutyric acid, has an inhibitory effect on nerve signaling. Some anticonvulsants intensify these inhibitory effects. Here's an overview of anticonvulsants. Acetazolamide. Acetazolamide is also available under the brand name Diamox. It is an anticonvulsant carbonic anhydrase inhibitor. Acetazolamide is used as an adjunct in the treatment of edema due to congestive heart failure or drug-induced edema. Acetazolamide is administered via extended-release capsules, tablets, or intravenously. Side effects of acetazolamide use may include anorexia, melena, constipation, renal colic or calculi, crystalluria, polyuria, phosphaturia, impotence, seizures, malaise, flaccid paralysis, lassitude, paresthesias of the extremities, bone marrow depression, thrombocytopenic purpura, hemolytic anemia, leukopenia, pancytopenia, agranulocytosis, skin rashes, Stevens-Johnson syndrome, toxic epidermal necrolysis, photosensitivity, weight loss, fever, acidosis, electrolyte imbalance, transient myopia, and hepatic insufficiency. Carbamazepine. Carbamazepine is also available under the brand name Tegretol. Carbamazepine is an anticonvulsant. It is used to treat partial seizures with complex symptoms. It may also be used in the treatment of tonic and clonic seizures, diseases with mixed seizure patterns, or other partial or generalized seizures. Serious side effects of carbamazepine use may include gastric distress, glossitis, stomatitis, aplastic anemia, leukopenia, eosinophilia, thrombocytopenia, agranulocytosis, leukocytosis, pancytopenia, bone marrow depression, visual hallucinations, hyperacusis, abnormal involuntary movements, behavioral changes in children, paralysis and other symptoms of cerebral arterial insufficiency, arrhythmias, Stevens-Johnson syndrome, alopecia, oculomotor disturbance, conjunctivitis, abnormal liver function studies, cholestatic or hepatocellular jaundice, hepatitis, inappropriate ADH secretion syndrome, and frank water intoxication with hyponatremia and confusion. Clonazepam. Clonazepam is also available under the brand name Klonopin. Clonazepam is an anticonvulsant benzodiazepine derivative. Clonazepam increases presynaptic inhibition and suppresses the spread of seizure activity. Clonazepam is used primarily in the treatment of petit mal absent seizures, including Lennox-Gastaut syndrome, akinetic, and myoclonic seizures. Clonazepam may elicit or precipitate grand mal seizures in patients suffering from multiple types of seizure disorders. Ethosuximid. Ethosuximid is also available under the brand name Zorantin. Ethosuximid is a succinimide-type anticonvulsant used in the treatment of absent seizures, also called petit mal. Gabapentin. Gabapentin is also available under the brand name Neurontin. It is an anticonvulsant. Gabapentin is used as an adjunct in the treatment of partial seizures, both with and without secondary generalization. The most common side effects of gabapentin use include somnolence, ataxia, dizziness, and fatigue. Phenobarbital. Phenobarbital is also available under the brand name Solphaton. It is a barbiturate-type sedative and anticonvulsant. Phenobarbital is used for the emergency control of acute seizure disorders such as status epilepticus, meningitis, tetanus, eclampsia, and toxicity of local anesthetics. Serious side effects may include apnea, respiratory depression, circulatory collapse, angioedema, Stevens-Johnson syndrome, and toxic epidermal necrolysis. Phenytoin. It is also available under the brand name Dilantin. Phenytoin is a hydantoin-type anticonvulsant and type 1 antiarrhythmic. It acts in the motor cortex of the brain to reduce the spread of electric discharge from the rapidly firing epileptic foci in this area. Phenytoin is used in cases of chronic epilepsy, specifically of the tonic-clonic psychomotor type of epilepsy. Serious side effects of phenytoin use may include seizures, Stevens-Johnson syndrome, epidermal necrolysis, agranulocytosis, aplastic anemia, hemolytic anemia, hepatocellular necrosis, and pulmonary fibrosis. Rapid parenteral administration may cause serious cardiovascular side effects. Primidone. Primidone is also available under the brand name Misoline. Primidone is an anticonvulsant. It is used either alone or with other anticonvulsants to treat psychomotor seizures, focal seizures, or tonic-clonic seizures. Side effects may include ataxia, vertigo, fatigue, emotional or personality disturbance, anorexia, painful gums, megaloblastic anemia, thrombocytopenia, diplopia, nystagmus, impotence, morbilliform and maculopapular skin rash. Valproic acid. Valproic acid is also available under the brand name Depacaine. Valproic acid is an anticonvulsant. It can be used either alone or in combination with other anticonvulsants for the treatment of simple and complex absence seizures called petit mal seizures. Valproic acid is also used as an adjunct treatment in multiple seizure patterns, which include absence seizures. Side effects may include indigestion, abdominal distress, sedation, psychosis, emotional upset, hyperactivity, tremor, headache, dizziness, spots before the eyes, thrombocytopenia, leukopenia, eosinophilia, anemia, bone marrow suppression, relative lymphocytosis, hypofibrinogenemia, myelodysplastic-type syndrome, transient alopecia, petechiae, erythema multiforme, skin rashes, Stevens-Johnson syndrome, hepatotoxicity, and in rare cases, coma. Welcome to the section on antidepressants. Antidepressants are used to stimulate the moods of patients suffering from all forms of clinical depression. Tricyclic antidepressants are a group of antidepressant medications that share chemical characteristics, side effects, and toxicity. Monoamine oxidase inhibitors are a chemically heterogeneous group of drugs. Monoamine oxidase inhibitors block oxidative deamination of naturally occurring monoamines. Monoamine oxidase inhibitors are as effective as tricyclic antidepressants in the treatment of major depression. However, the complex, sometimes severe, and often unpredictable interactions between monoamine oxidase inhibitors and many other drugs and food make their medical use difficult and potentially hazardous. Here's an overview of antidepressants. Transilipramine sulfate. Transilipramine sulfate is available under the brand name Parnate. It is an antidepressant and monoamine oxidase inhibitor. Due to inhibition of monoamine oxidase during transilipramine use, the concentration of epinephrine, norepinephrine, and serotonin increases in storage sites throughout the nervous system. This increase is believed to be the cause of antidepressant effects. Transilipramine is used in the treatment of major depressive episodes. However, the benefits of using transilipramine sulfate is still being investigated for the following: bulimia, obsessive-compulsive disorder, and manifestations of psychotic disorders as well as social phobia, seasonal affective disorder, multiple sclerosis, and idiopathic orthostatic hypotension called Shy-Drager syndrome. The side effects of transilipramine use include anxiety, significant anorexia, nausea, palpitation, urinary retention, impaired ejaculation, muscle spasm, leukopenia, agranulocytosis, thrombocytopenia, blurred vision, hepatitis, skin rash, and tinnitus. Imipramine hydrochloride. Imipramine hydrochloride is available under the brand name Tofranil. Imipramine hydrochloride is a tricyclic antidepressant. It triggers moderate anticholinergic effects, sedative effects, and high orthostatic hypotensive effects. In high dosage, a known side effect of imipramine use is increased frequency of seizures in epileptic patients and potential seizures in non-epileptic patients. Amitriptyline hydrochloride. Amitriptyline is also available under the brand name Elavil. Amitriptyline is a tricyclic antidepressant. It is metabolized to an active metabolite, nortriptyline. Amitriptyline has a significant anticholinergic and sedative effect with moderate orthostatic hypotension. In addition, amitriptyline significantly blocks serotonin uptake and moderates activity with respect to norepinephrine uptake. Amitriptyline is useful in the treatment of symptoms of depression, anxiety, and insomnia, as well as the relief of chronic pain resulting from cancer or other pain syndromes. The benefits of amitriptyline are still being investigated for the following: in cases of pathologic emotional outbursts due to forebrain disease, bulimia nervosa, anti-ulcer agent, enuresis, and as an adjunct analgesic for phantom limb pain, migraine, chronic tension headache, diabetic neuropathy, tic douloureux, cancer pain, peripheral neuropathy with pain, postherpetic neuralgia, and arthritic pain. Amoxapine. Amoxapine is also available under the brand name Ascendin. Amoxapine is a tricyclic antidepressant used to treat endogenous and psychotic depression. Amoxapine is used to treat neurotic or reactive depression. Side effects may include tardive dyskinesia. Bupropion hydrochloride. Bupropion hydrochloride is also available under the brand name Wellbutrin. It is an antidepressant smoking deterrent. Bupropion hydrochloride is generally used for the short-term treatment of depression and as an aid to stop smoking. Serious side effects of bupropion use may include anxiety, seizures, sensory disturbances, impaired sleep quality, decreased memory, pseudo-Parkinsonism, akathisia, hyperkinesia, paresthesias, central nervous system stimulation, increased or decreased libido, delusions, suicidal ideation, mania or hypomania, hallucinations, depression, psychosis, formal thought disorder, stomatitis, bruxism, glossitis, jaundice, liver damage, cardiac arrhythmias, hypertension, testicular swelling, prostate disorder, rash, infection, cutaneous temperature disturbance, flu-like syndromes, and nonspecific pain. The next drug is clomipramine hydrochloride. Clomipramine hydrochloride is also available under the brand name Anafranil. Clomipramine hydrochloride is a tricyclic antidepressant. Clomipramine hydrochloride is used in the treatment of obsessive-compulsive disorder in cases where the obsessions or compulsions cause marked distress or significantly interfere with social or occupational activity. Clomipramine may also be used to treat panic attacks and cataplexy associated with narcolepsy. Side effects may include hyperthermia, especially when used in combination with other drugs, increased risk of seizures, asthenia, anemia, eructation, sexual dysfunction in males, laryngitis, vestibular disorders, and muscular weakness. Dicipramine hydrochloride. Dicipramine hydrochloride is also available under the brand name Norpramine and Pertofrane. Dicipramine hydrochloride is a tricyclic antidepressant. It is used to treat symptoms of depression, bulimia nervosa, and to decrease craving and depression during cocaine withdrawal. A bad taste in the mouth is the most commonly reported side effect of dicipramine hydrochloride use. Nortriptyline hydrochloride. Nortriptyline hydrochloride is also available under the brand name Aventil. Nortriptyline hydrochloride is a tricyclic antidepressant. It manifests moderate anticholinergic and sedative effects, but slight orthostatic hypotensive effect. Nortriptyline hydrochloride is used to treat the symptoms of depression, as well as chronic severe neurogenic pain. Dermatologic disorders included chronic urticaria, angioedema, and nocturnal pruritus in atopic eczema. Paroxetine hydrochloride. Paroxetine hydrochloride is available under the brand name Paxil. Paroxetine hydrochloride is an antidepressant. It is used in the treatment of major depressive episodes, panic disorder with or without agoraphobia, obsessive-compulsive disorders, and social anxiety disorders. Side effects of paroxetine use may include headache, seizures, activation of mania or hypomania, drugged feeling, myoclonus, central nervous system stimulation, amnesia, emotional lability, vertigo, abnormal thinking, akinesia, alcohol abuse, ataxia, convulsions, possibility of suicide, depersonalization, hallucinations, hyperkinesia, hypertonia, lack of emotion, manic or paranoid reactions, abdominal distress, oropharyngeal disorders, rectal hemorrhage, monoliasis, and anorexia. Phenelzine sulfate. Phenelzine sulfate is also available under the brand name Nardil. Phenelzine sulfate is an antidepressant in the category of monoamine oxidase inhibitor. Phenelzine sulfate presents MAO from metabolizing biogenic amines. The antidepressant effect is due to accumulation of biogenic amines in presynaptic granules. This increases the concentration of neurotransmitters released upon nerve stimulation. Phenelzine is used to treat cases of depression characterized as atypical, non-endogenous, or neurotic, particularly in patients who have mixed anxiety and depression and phobic or hypochondriacal symptoms. Side effects may include dizziness, headache, sleep disturbance including insomnia and hypersomnia, palalia, euphoria, nystagmus, paresthesias, ataxia, shock-like coma, toxic delirium, manic reaction, convulsions, acute anxiety reactions, schizophrenia, reversible jaundice, and in rare cases, fatal necrotizing hepatocellular damage. Protriptyline hydrochloride. Protriptyline is also available under the brand name Vivactil. Protriptyline is a tricyclic antidepressant with significant anticholinergic effects. Tritryptyline has low sedative and orthostatic hypotensive effects. Protriptyline is primarily used to treat the symptoms of depression. Sertraline hydrochloride. Sertraline hydrochloride is also available under the brand name Zoloft. It is an antidepressant and used in the treatment of depression with reduced psychomotor agitation, anxiety, and insomnia. Sertraline hydrochloride may also be used to treat obsessive-compulsive and panic disorders. Serious side effects may include vomiting, teeth grinding, eructation, palpitations, hypertension, hypotension, peripheral ischemia, postural hypotension or dizziness, syncope, tachycardia, activation of mania or hypomania, seizures, anxiety, aggressive reaction, amnesia, apathy, delusion, depersonalization, aggravated depression, emotional lability, euphoria, hallucinations, neurosis, paranoid reaction, suicidal ideation, hypokinesia, rigors, lymphadenopathy, and purpura. Trazodone hydrochloride. Trazodone hydrochloride is also available under the brand name Desirel. Desirel is an antidepressant used in the treatment of depression, either with or without accompanying anxiety. Side effects may include dermatitis, blurred vision, constipation, skeletal muscle aches and pains, hypertension or hypotension, syncope, palpitations, tachycardia, priapism, hematuria, and impaired memory. Rare side effects include hallucination, impaired speech, tremors, and paresthesias. Doxepine hydrochloride. Doxepine hydrochloride is also available under the brand names Atipin and Sinequan. Doxepine hydrochloride is a tricyclic antidepressant. Doxepine hydrochloride is used to treat psychoneurotic patients with depression or anxiety due to organic disease or alcoholism. Doxepine hydrochloride is also used to treat psychotic depressive disorders with associated anxiety and depression or anxiety associated with organic disease. Doxepine has a high incidence of side effects, including a high degree of sedation, decreased libido, extrapyramidal symptoms, dermatitis, pruritus, fatigue, weight gain, edema, paresthesia, breast engorgement, insomnia, tremor, chills, tinnitus, and photophobia. Fluoxetine hydrochloride. Fluoxetine hydrochloride is also available under the brand name Prozac. Fluoxetine hydrochloride is an antidepressant. It is used primarily for the treatment of depression, obsessive-compulsive disorders, and bulimia in adults and geriatric patients. Side effects of fluoxetine use include activation of mania or hypomania, anxiety, decreased libido, disturbances in sensation, abnormal dreams, vomiting, abdominal pain, palpitations, sexual dysfunction, urinary tract infection, dysmenorrhea, pharyngitis, rash, excessive sweating, muscle, joint, or back pain, flu-like symptoms, visual disturbance, weight loss, bacterial or viral infections, and chills. The next drug is meprodoline hydrochloride. Meprodoline is also available under the brand name Lidiamil. Meprodoline is a tetracyclic antidepressant. Meprodoline is used to treat depressive illnesses such as depressive neuroses, manic depressive illness, and major depressive disorder. Duloxetine. Duloxetine is also known under the brand name Cymbalta. Duloxetine is an oral, dual, reuptake inhibitor that enhances the levels of the neurotransmitters serotonin and norepinephrine, which are involved in depression. Duloxetine is indicated for the treatment of major depressive disorder. Duloxetine is also indicated for the management of diabetic peripheral neuropathic pain. Side effects include nausea, dry mouth, constipation, decreased appetite, fatigue, somnolence, and increased sweating. Welcome to the section on anti-diabetics. Anti-diabetics are agents that are used to treat, prevent, or alleviate the occurrence of diabetes. Diabetes is a general term referring to disorders which are characterized by excessive urine excretion, such as diabetes mellitus and diabetes insipidus. When used alone, the term diabetes usually refers to diabetes mellitus. Here's an overview of anti-diabetics. Metformin hydrochloride. Metformin hydrochloride is also available under the brand name Glucophage. Metformin hydrochloride is an oral anti-diabetic. It decreases the production of hepatic glucose. Metformin hydrochloride also decreases intestinal absorption of glucose and increases the peripheral uptake and utilization of glucose. Metformin can be used either alone or as an adjunct to lower blood glucose in patients having non-insulin-dependent diabetes whose blood glucose cannot be managed satisfactorily with diet alone. Metformin hydrochloride can also be used with insulin in type 2 diabetes. Side effects of metformin use may include diarrhea, abdominal bloating, anorexia, unpleasant or metallic taste, asymptomatic subnormal serum vitamin B12 levels, and lactic acidosis. Lactic acidosis is fatal in approximately 50% of cases. Exenatide. Exenatide is also known under the brand name Yetta. Exenatide is derived from a compound found in the saliva of the Gila monster, a large lizard native to the southwestern United States. Exenatide is a functional analog of glucagon, like peptide 1, a naturally occurring peptide which enhances insulin secretion in response to elevated plasma glucose levels. By mimicking the function of glucagon like peptide 1, the drug helps more strongly activate this pathway to improve glycemic control. Exenatide is specifically indicated as adjunctive therapy to improve glycemic control in patients with type 2 diabetes mellitus who are taking metformin, a sulfonylurea or a combination of both, and have not achieved adequate glycemic control. Side effects include nausea, vomiting, diarrhea, jittery sensation, dizziness, headache, and dyspepsia. Pramlintide. Pramlintide is also known under the brand name Symlin. Pramlintide is an anti-hyperglycemic agent. It is designed to mimic the activity of the naturally occurring hormone amylin, which is secreted together with insulin and is involved in postprandial glucose control. Pramlintide is specifically indicated for the mealtime treatment of type 1 and type 2 diabetes in combination with standard insulin therapy in those patients who have failed to achieve adequate glucose control on insulin monotherapy. Pramlintide can also be administered to type 2 diabetics on metformin or sulfonylurea therapy. Side effects include nausea, headache, anorexia, vomiting, abdominal pain, fatigue, dizziness, and coughing. Sitagliptin phosphate. Sitagliptin phosphate is also known under the brand name Januvia. Sitagliptin phosphate is an orally active inhibitor of the dipeptidyl peptidase 4 enzyme called DPP4. The DPP4 enzyme inactivates incretin hormones, which are involved in the physiological regulation of glucose homeostasis. By inhibiting DPP4, sitagliptin phosphate increases and prolongs active incretin levels. This in turn increases insulin release and decreases glucagon levels in the circulation in a glucose-dependent manner. Sitagliptin phosphate is specifically indicated for the improvement of glycemic control in patients with type 2 diabetes mellitus as monotherapy. Sitagliptin phosphate is also used as combination therapy with metformin or a peroxisome proliferator activated receptor gamma agonist when the single agent does not provide adequate glycemic control. Side effects include upper respiratory tract infection, nasopharyngitis, and headache. Welcome to the section on antidiuretics. Antidiuretics are used to suppress the rate of urine formation in patients suffering from abnormal flow. Here's an overview of antidiuretics. Desmopressin acetate. Desmopressin acetate is also available under the brand name Stymate. Desmopressin acetate is a synthetic antidiuretic hormone. It is used in cases of hemophilia A with factor VIII levels greater than 5%. Desmopressin acetate is used in the treatment of von Willebrand's disease with factor VIII levels greater than 5%. Side effects of desmopressin use include agitation, balanitis, chest pains, chills, dizziness, dyspepsia, edema, insomnia, itchy or light-sensitive eyes, pain, palpitations, somnolence, tachycardia, and vomiting. Vasopressin. Vasopressin is also available under the brand name Pitressin Synthetic. Vasopressin is a pituitary hormone. It is used to treat neurogenic diabetes insipidus. Side effects may include increased intestinal activity, abdominal cramps, flatus, facial pallor, tremor, sweating, allergic reactions, vertigo, skin blanching, bronchoconstriction, anaphylaxis, pounding in the head, and water intoxication. Welcome to the chapter on anti-gout agents. Anti-gout agents are used to treat recurrent acute arthritis of peripheral joints called gout. Gout is caused by the accumulation of monosodium urate crystals. Here's an overview of anti-gout agents. Allopurinol. Allopurinol is also available under the brand name Xyloprim. Allopurinol is an anti-gout agent and is a potent inhibitor of xanthine oxidase. This results in decreased levels of uric acid. Allopurinol is used in the treatment of leukemia, lymphoma, and solid tumor malignancies. One common side effect of allopurinol use is pruritic maculopapular skin rash, which may be accompanied by fever and malaise. Other side effects may include vesicular bullous dermatitis, eczematoid dermatitis, lichen planus, Stevens-Johnson syndrome, toxic epidermal necrolysis, intermittent abdominal pain, leukopenia, eosinophilia, thrombocytopenia, leukocytosis, cholestatic jaundice, hepatic necrosis, necrotizing angiitis, hypersensitivity vasculitis, ecchymoses, epistaxis, arthralgia, acute attacks of gout, renal failure, uremia, and alopecia. Colchicine. Colchicine is an anti-gout agent used in cases of prophylaxis. Colchicine is also used in the treatment of acute attacks of gout. Colchicine is toxic, and patients must be carefully monitored. Side effects include diarrhea, abdominal cramping, aplastic anemia, agranulocytosis or thrombocytopenia following long-term therapy, peripheral neuritis, purpura, myopathy, neuropathy, alopecia, reversible azospermia, dermatoses, hypersensitivity, thrombophlebitis at the injection site, and liver dysfunction. If any of these side effects occur, colchicine use should be discontinued at once. Sulfenpyrazone. Sulfenpyrazone is also available under the brand name Anturain. Sulfenpyrazole is a uricosuric agent. It inhibits tubular reabsorption of uric acid, increasing its excretion. Sulfenpyrazone is used in cases of chronic and intermittent gouty arthritis. Side effects of sulfenpyrazone use include abdominal discomfort, leukopenia, agranulocytosis, anemia, thrombocytopenia, aplastic anemia, skin rash, and bronchoconstriction in aspirin-induced asthma. Acute attacks of gout may become more frequent during initial therapy. If this occurs, sulfenpyrazone should be given concomitantly with colchicine. Probenecid. Probenecid is also available under the brand name Benamid. Probenecid is an anti-gout agent and uricosuric agent. It increases the excretion of uric acid by inhibiting the tubular reabsorption of uric acid. This results in a decreased serum level of uric acid. Probenecid also inhibits the renal secretion of penicillins and cephalosporins. This effect increases plasma levels of antibiotics and therefore is a useful adjunct in the treatment of infections. Side effects of probenecid use can include headaches or dizziness, anorexia, abdominal discomfort, skin rash, fever, nephrotic syndrome, uric acid stones with or without hematuria, renal colic or costovertebral pain, anemia, sore gums, hepatic necrosis, aplastic anemia, and, in rare cases, anaphylaxis. Welcome to the section on antihistamines. Antihistamines are used to counteract the histamine which is released during an allergic reaction. They block the action of histamine on the tissue. Antihistamines do not prevent the formation of histamine, nor do they stop the conflict between IgE and antigen. Therefore, antihistamines do not stop the allergic reaction. However, antihistamines relieve the symptoms of the allergic reaction and protect tissues from some of its effects. Here's an overview of antihistamines. Chlorpheniramine maleate. Chlorpheniramine maleate is also available under the brand name chlortrimeton. It is an alkylamine-type antihistamine. It is used in the treatment of allergic rhinitis and allergic reactions to blood and plasma. Chlorpheniramine maleate may also be used as an adjunct to anaphylaxis therapy. Cimetidine. Cimetidine is also available under the brand name Tagamet. Cimetidine is a histamine H2 receptor-blocking agent. Cimetidine reduces postprandial daytime and nighttime gastric acid secretion. Cimetidine is primarily used in the treatment and maintenance treatment of active duodenal ulcers. Side effects may include diarrhea, hepatitis or hepatic fibrosis, delirium, hallucinations, double vision, dysarthria, and ataxia. Cyclazine hydrochloride. Cyclazine is also available under the brand name Marazine. It is an antiemetic antihistamine used to treat nausea, vomiting, and dizziness of motion sickness. Side effects may include drowsiness, nervousness, insomnia, euphoria, vertigo, auditory or visual hallucinations, diarrhea, constipation, anorexia, urinary frequency or retention, hypotension, tachycardia, palpitations, dry nose and throat, blurred or double vision, tinnitus, rash, and urticaria. Cyproheptadine hydrochloride. Cyproheptadine hydrochloride is also available under the brand name Periactin. It is a piperidine-type antihistamine. It is used in the treatment of hypersensitivity reactions such as perennial and seasonal allergic rhinitis, vasomotor rhinitis, allergic conjunctivitis, and uncomplicated allergic skin reactions of urticaria and angioedema. Cyproheptadine hydrochloride is also used to treat allergic reactions to blood or plasma, cold urticaria, and also as an adjunct to treating anaphylaxis and dermographism. Increased appetite is a known side effect of cyproheptadine use. Dimenhydrinate. Dimenhydrinate is also available under the brand name Dramamine. Dimenhydrinate is an antiemetic antihistamine which contains both diphenhydramine and chlorotheophylline. Dimenhydrinate is primarily used in the treatment of motion sickness to relieve nausea, vomiting, and dizziness. Diphenhydramine hydrochloride. Diphenhydramine hydrochloride is also available under the brand name Benadryl. Diphenhydramine hydrochloride is an ethanolamine-type antihistamine antiemetic. It is used in the treatment of hypersensitivity reactions, motion sickness, Parkinsonism, and as a nighttime sleeping aid. Fexofenadine hydrochloride. Fexofenadine hydrochloride is also available under the brand name Allegra. Fexofenadine hydrochloride is an antihistamine, and it is used to treat seasonal allergic rhinitis, which may result in sneezing, rhinorrhea, itchy nose, throat, or palate, and itchy, watery, and red eyes. Side effects may include fatigue, headache, nausea, dyspepsia, sinusitis, throat irritation, viral infection, and dysmenorrhea. Meclizine hydrochloride. Meclizine hydrochloride is also available under the brand name Antivert. Meclizine hydrochloride is a piperidine-type antihistamine, antiemetic, and anti-motion sickness drug. Meclizine hydrochloride is used to treat nausea and vomiting, dizziness, vertigo, and other diseases associated with the vestibular system. Side effects may include drowsiness, excitation, nervousness, euphoria, vertigo, auditory or visual hallucinations, diarrhea, constipation, anorexia, difficulty with urination, hypotension, tachycardia, palpitations, dry nose or throat, blurred or double vision, tinnitus, rash, and urticaria. Promethazine hydrochloride. Promethazine hydrochloride is also available under the brand name Phenergan. Promethazine hydrochloride is a phenothiazine-type antihistamine. It is used for prophylaxis and treatment of motion sickness, as well as the prophylaxis of nausea and vomiting due to anesthesia or surgery. Promethazine hydrochloride may also be used as a pre- or post-operative sedative or as an obstetric sedative. Promethazine hydrochloride can be used to treat hypersensitivity reactions and as an adjunct in the treatment of anaphylaxis or anaphylactoid reactions. Side effects of promethazone use may include leukopenia and agranulocytosis. Famotidine. Famotidine is also available under the brand name Pepcid. Famotidine is a histamine H2 receptor antagonist. Famotidine is used in the treatment of active duodenal ulcers and the maintenance therapy for duodenal ulcer. Side effects may include abdominal discomfort, dizziness, headache, paresthesias, depression, anxiety, hallucinations, insomnia or fatigue, grand mal seizure, psychic disturbances, rash, palpitations, arthralgia, asthenia, musculoskeletal pain, thrombocytopenia, fever, orbital edema, conjunctival injection, bronchospasm, tinnitus, taste disorders, decreased libido, and transient pain at the injection site. Nizatidine. Nizatidine is also available under the brand name Axid. Nizatidine is a histamine H2 receptor antagonist. Nizatidine decreases gastric acid secretion by blocking the effect of histamine or histamine H2 receptors. Nizatidine is primarily used in the treatment of acute duodenal ulcer and maintenance following healing of a duodenal ulcer. Side effects may include headache, fatigue, abnormal dreams, anxiety, nervousness, pancreatitis or abdominal discomfort, exfoliative dermatitis, rhinitis, pharyngitis, chest pain, infection, fever, myalgia, impotence, gout, cholestatic or hepatocellular effects, and in rare cases cardiac arrhythmias or arrest following rapid IV use. Levocetirizine dihydrochloride. Levocetirizine dihydrochloride is also known under the brand name Prezista. It is an antihistamine which is orally active and a selective H1 receptor antagonist. Histamines acting on H1 receptors cause the symptoms commonly seen in allergic reactions. Levocetirizine inhibits these H1 receptors. Levocetirizine is specifically indicated for the relief of symptoms associated with allergic rhinitis, both seasonal and perennial. Levocetirizine is also indicated for the treatment of uncomplicated skin manifestations of chronic idiopathic urticaria in adults and children 6 years of age or older. Side effects in the adult population include somnolence, nasopharyngitis, fatigue, dry mouth, and pharyngitis. Side effects for the pediatric population, age 6 to 12, include fever, cough, somnolence, and epistaxis. Welcome to the section on antihypertensives. Antihypertensives are agents that are used to reduce high blood pressure. Here's an overview of antihypertensives. The first drug in this category is guanethidine monosulfate. Guanethidine is also known as ismalin sulfate. Guanethidine is a peripherally acting antiadrenergic antihypertensive drug. It is used to moderate hypertension, including renal hypertension, renal artery stenosis, and renal amyloidosis. Guanethidine is instrumental in depleting norepinephrine reserve and inhibiting norepinephrine release. This produces selective adrenergic blockade of efferent peripheral sympathetic pathways. This results in a prolonged, gradual drop in systolic and diastolic blood pressure, as well as a decreased pulse pressure and a lowering of peripheral vascular resistance. Side effects of guanethidine use include dizziness, weakness, and lassitude. In rare cases, fatigue and depression have been known to occur. Clonidine hydrochloride. Clonidine is also known under its brand name, Catapress. Clonidine is a centrally acting antiadrenergic antihypertensive. It stimulates the alpha-adrenergic receptors of the central nervous system. This results in the inhibition of the sympathetic vasomotor centers and decreased nerve impulses. Notably, during the use of clonidine, plasma renin levels are decreased. However, peripheral venous pressure remains unchanged. Clonidine is administered either orally in tablet form or transdermally. It is used in cases of mild to moderate hypertension. The benefits of clonidine are still being investigated for the following: alcohol withdrawal, opiate detoxification, atrial fibrillation, attention deficit hyperactivity disorder, cyclosporine-associated nephrotoxicity, constitutional growth delay in children, Tourette syndrome, hyperhidrosis, diagnostic testing of pheochromocytoma, and postherpetic neuralgia and schizophrenia. Clonidine is effective in the relief of neuropathic pain when administered via epidural injection. Common side effects of clonidine include drowsiness and dry mouth. Guanabenz acetate. Guanabenz is a centrally acting antiadrenergic hypertensive. It decreases the pulse rate, sympathetic impulses, and sympathetic tone by stimulating the alpha-2 adrenergic receptors in the central nervous system. Guanabenz is used either by itself or with thiazide diuretics to treat hypertension. Common side effects of guanabenz use are drowsiness and dry mouth. Other known side effects include dizziness, headache, depression, sleep disturbance, heart palpitation, chest pain, and arrhythmias. Guanfacine hydrochloride. Guanfacine hydrochloride is also known under its brand name Tenex. It is a centrally acting hypertensive drug. Though its mechanism is undetermined, guanfacine hydrochloride is thought to act by centrally stimulating the alpha-2 receptors. This causes a decrease in peripheral sympathetic output and heart rate, thereby resulting in a decrease in blood pressure. Guanfacine can be used alone or with a thiazide diuretic to treat hypertension. The benefits of guanfacine hydrochloride in the treatment of heroin withdrawal and migraine headache are currently being investigated. Side effects of guanfacine use include nausea, bradycardia, substernal pain, palpitations, cardiac fibrillation, congestive heart failure, and heart block. Ophthalmic side effects include conjunctivitis, iritis, and blurred vision. Methyl-dopa. Methyl-dopa has the brand name Aldomet. It is a centrally acting antiadrenergic antihypertensive and is used in the treatment of hypertension. Alpha-methylnorepinephrine is the active metabolite used to lower blood pressure by stimulating central inhibitory alpha-adrenergic receptors. Methyl-dopa is effective in cases of moderate to severe hypertension. It is particularly useful for patients with impaired renal function, renal hypertension, and resistant cases of hypertension which have been complicated by stroke, carotid artery disease, or nitrogen retention. The side effects of methyl-dopa include transient sedation, asthenia, paresthesias, chorioathetotic movements, Bell's palsy, decreased mental acuity, verbal memory impairment, and Parkinson-like syndrome. Cardiovascular side effects include bradycardia, orthostatic hypotension, and hypersensitivity of the carotid sinus. Other side effects of methyl-dopa are toxic epidermal necrolysis, jaundice, hepatitis, abnormal liver functions, lupus-like symptoms, and septic shock-like syndrome. Doxazazine mesylate. Doxazazine mesylate is available under the brand name Cardura. It is an antihypertensive which blocks the post-junctional alpha-1 adrenergic receptors. This results in a decrease in systemic vascular resistance and a corresponding decrease in blood pressure. Doxazazine mesylate is used either alone or in combination with diuretics, calcium channel blockers, or beta blockers to treat hypertension. The most frequent side effect of doxazazine mesylate use is dizziness. Prazosine hydrochloride. Prazosine hydrochloride is available under the brand name Minipress. Prazosine hydrochloride is an antihypertensive alpha-1 adrenergic blocking agent that produces selective blockade of postsynaptic alpha-1 adrenergic receptors and dilates arterioles and veins. This decreases total peripheral resistance, which decreases diastolic blood pressure more than systolic while leaving cardiac output intact. Heart rate and renal blood flow are not affected. Prazosine can be used to initiate antihypertensive therapy. However, prazosine hydrochloride is most effective when used in combination with other agents such as diuretics or beta-adrenergic blocking agents. Prazosine is used to treat mild to moderate hypertension, either alone or in combination with other antihypertensive drugs. Cardiovascular side effects of prazosine use include palpitations, syncope, tachycardia, orthostatic hypotension, and aggravation of angina. Gastrointestinal side effects include diarrhea or constipation, abdominal pain, and pancreatitis. Other known side effects of prazosine use include paresthesias, depression, hallucinations, urinary frequency or incontinence, impotence, priapism, lichen planus, asthenia, edema, symptoms of lupus erythematosus, blurred vision, reddening of the sclera, eye pain, conjunctivitis, edema, and fever. Taurazocine. Taurazocine is available under the brand name Hytrin. Taurazocine is an antihypertensive alpha-1 adrenergic receptor blocking agent that acts by blocking postsynaptic alpha-1 adrenergic receptors. This leads to a dilation of both arterioles and veins and ultimately a reduction in blood pressure. Taurazocine is used either alone or in combination with diuretics or beta-adrenergic blocking agents to treat hypertension and to treat the symptoms of benign prostatic hyperplasia. Side effects of taurazocine use include a first dose effect of marked postural hypotension with syncope, palpitations, tachycardia, and bronchospasm, cold, and flu symptoms, as well as vomiting, abdominal discomfort or pain, arthritis, urinary tract infection, conjunctivitis, abnormal vision, edema, and facial edema. Mecamylamine hydrochloride. Mecamylamine hydrochloride is also available under the brand name Inversine. Mecamylamine hydrochloride is an antihypertensive ganglionic blocking agent used to treat hypertension. Side effects of mecamylamine use may include constipation, glossitis, anorexia, ileus, weakness, impotence, and in rare instances, choreiform movements, mental aberrations, tremors, and seizures. Amlodipine. Amlodipine is also available under the brand name Norvasc. Amlodipine is a calcium channel blocking anti-anginal antihypertensive agent used in the treatment of hypertension. Side effects may include headache, lethargy, sleep disturbance, depression, amnesia, psychosis, hallucinations, tremor, depersonalization, nausea, abdominal discomfort, palpitations, ventricular extrasystole, peripheral ischemia, cardiac failure, pulse irregularity, and parosmia. Benazepril hydrochloride. Benazepril hydrochloride is also available under the brand name Lotensin. Benazepril hydrochloride is an antihypertensive and angiotensin-converting enzyme, or ACE, inhibitor. Benazepril hydrochloride is used either alone or in combination with thiazide diuretics to treat hypertension. Side effects may include headache, anxiety, insomnia, abdominal pain, symptomatic or postural hypertension, palpitations, peripheral edema, impotence, bronchitis, arthritis, decreased hemoglobin, and angioedema. Captopril. Captopril is also available under the brand name Capoten. Captopril is an antihypertensive inhibitor of angiotensin synthesis. It may be used alone or in combination with other antihypertensive drugs to treat hypertension. Captopril is also used in combination with diuretics and digitalis in treatment of congestive heart failure. Side effects may include Stevens-Johnson syndrome, reversible pemphigoid-like lesions, bullous pemphigus, scalded mouth sensation, gastric irritation, abdominal pain, peptic or aphthous ulcers, jaundice, cholestasis, hepatitis, Raynaud's phenomenon, rhinitis, and eosinophilic pneumonitis. Nitroprusside sodium. Nitroprusside sodium is also available under the brand name Nitropress. It is an antihypertensive. Nitroprusside sodium has a direct action on vascular smooth muscle. This leads to peripheral vasodilation of arteries and veins. Nitroprusside sodium acts on the excitation-contraction coupling of vascular smooth muscle by interfering with both influx and intracellular activation of calcium. Nitroprusside sodium has no effect on the smooth muscle of the duodenum or uterus. Nitroprusside sodium is more active on veins than on arteries. It is used in cases of hypertensive crisis to reduce blood pressure immediately. Nitroprusside may also be used to produce controlled hypotension during anesthesia to reduce bleeding and as a treatment in cases of acute congestive heart failure. Side effects may include excessive hypotension. Diazoxide. Diazoxide IV is also available under the brand name Hyperstat IV. Diazoxide IV is an antihypertensive. It takes direct action on vascular smooth muscle, causing arterial vasodilation and decreased peripheral resistance. Administered via IV push, diazoxide IV is primarily used in treating malignant and non-malignant hypertension. Side effects may include hypotension severe enough to cause shock. Other side effects include sodium and water retention, atrial or ventricular arrhythmia, cerebral or myocardial ischemia, marked ECG changes with the possibility of MI palpitations, seizures, paralysis, sensation of choking, transient neurological findings due to alteration in regional blood flow to the brain, hyperosmolar coma in infants, cellulitis without sloughing, warmth or pain along the injection site, phlebitis at the injection site, extravasation, and in rare cases, acute pancreatitis. Diltiazem hydrochloride. Diltiazem hydrochloride is also available under the brand name Cardizem. Diltiazem hydrochloride is an anti-aginal, antihypertensive calcium channel blocking agent. It is used to treat cases of vasospastic angina called Prinzmetal's variant. Diltiazem hydrochloride is also used to treat chronic stable angina, particularly in patients who cannot use beta-adrenergic blockers or nitrates, or who remain symptomatic after clinical doses of these agents. Side effects of diltiazem use may include AV block, bradycardia, arrhythmias, angina, Stevens-Johnson syndrome, joint pain or stiffness, nasal or chest congestion, sexual difficulties, hematoma, eye irritation, bundle branch block, abnormal gait, and hyperglycemia. Guanidrel sulfate. Guanidrel sulfate is also available under the brand name Hylarel. Guanidrel sulfate is a peripherally acting antiadrenergic antihypertensive. It has action and kinetics similar to that of guanethine. Guanidrel sulfate inhibits vasoconstriction by blocking efferent peripheral sympathetic pathways and depleting norepinephrine reserves and inhibiting norepinephrine release. This causes increased sensitivity to norepinephrine. Guanidrel is used in the treatment of hypertension in patients who do not respond to a thiazide diuretic. Side effects may include fainting, fatigue, headache, psychological problems, visual disturbance, abdominal distress or pain, impotence, joint pain or inflammation, and aching of the limbs. Hydralazine hydrochloride. Hydralazine hydrochloride is also available under the brand name Apresoline and is an antihypertensive. Hydralazine hydrochloride exerts a direct vasodilating effect on vascular smooth muscle. Hydralazine hydrochloride also alters cellular calcium metabolism that interferes with calcium movement within the vascular smooth muscle responsible for initiating or maintaining contraction. Hydralazine hydrochloride preferentially dilates arterioles compared with veins, thereby minimizing postural hypotension and increases cardiac output. Hydralazine hydrochloride also increases renin activity in the kidney. This leads to an increase in angiotensin II, which then causes stimulation of aldosterone and thus sodium reabsorption. Hydralazine is used in combination with other drugs for the treatment of essential hypertension. It may also be used to treat cases of severe essential hypertension where PO use is not possible or where there is an urgent need to lower blood pressure. Hydralazine is also the drug of choice for eclampsia. Side effect of hydralazine use may include orthostatic hypotension, angina pectoris, palpitations, paradoxical pressor reaction, tachycardia, psychoses, tremors, depression, anxiety, disorientation, paralytic ileus, a decrease in hemoglobin in red blood cells, lupus-like syndrome, lymphadenopathy, and splenomegaly. Lisinopril. Lisinopril is also available under the brand name Prinavil and Zestril. Lisinopril is an antihypertensive and ACE inhibitor. Lisinopril reduces both supine and standing blood pressures. Lisinopril is primarily used either alone or in combination with a diuretic, usually a thiazide, to treat hypertension. Lisinopril is also used in combination with digitalis and a diuretic for the treatment of congestive heart failure in cases where the patient is not responding to previous therapy. Serious side effects of lisinopril use may include hypotension, stroke, worsening of heart failure, decreased blood pressure, pulmonary embolism or infarction, paroxysmal nocturnal dyspnea, arthritis, hepatocellular or cholestatic jaundice, acute renal failure or dysfunction, angioedema which may be fatal if laryngeal edema occurs, bone marrow depression, malignant lung neoplasm, hemoptysis, and breast pain. Losartan potassium. Losartan potassium is also available under the brand name Cozar. Losartan potassium is an angiotensin II receptor antagonist. It is used in the treatment of hypertension. Severe side effects of losartan use may include CVA or stroke, myocardial infarction, ventricular tachycardia, and ventricular fibrillation. Minoxidil. Minoxidil is given in oral form. Minoxidil is also available under the brand name Loniten. Minoxidil is an antihypertensive. It depresses the sympathetic nervous system and decreases elevated blood pressure by decreasing peripheral resistance through a direct effect. Serious side effects of minoxidil use may include pericardial effusion that may progress to tamponade and Stevens-Johnson syndrome. Used topically under the name Rogaine, it is used to treat male pattern alopecia. Nicardipine hydrochloride. Nicardipine hydrochloride is also available under the brand name Cardene. Nicardipine hydrochloride is an anti-anginal, antihypertensive, calcium channel blocking agent. It moderately increases cardiac output and significantly decreases peripheral vascular resistance. Nicardipine hydrochloride is used in the treatment of chronic stable angina and hypertension. Side effects may include pedal edema, palpitations, tachycardia, hypotension, ventricular extrasystole, peripheral vascular disease, psychosis or hallucination, equilibrium disturbances, abnormal or blurred vision, infection, and atypical chest pain. Nifedipine. Nifedipine is also available under the brand name Procardia. Nifedipine is an anti-anginal, antihypertensive, calcium channel blocking agent. It is used to treat cases of vasospastic angina, which can be either Prinzmetal's or a variant. Nifedipine is also used to treat chronic stable angina without vasospasm and essential hypertension. Side effects may include peripheral and pulmonary edema, hypotension, palpitation, decreased platelet aggregation, arrhythmias, gastroesophageal reflux, sleep disturbance, psychoses, hallucinations, rash, Stevens-Johnson syndrome, arthritis, sexual difficulties, transient blindness, hyperglycemia, hypokalemia, hepatitis, facial and periorbital edema, gout, abnormal lacrimation, breast pain, dysuria, and hematuria. Quinapril hydrochloride. Quinapril hydrochloride is also available under the brand name Acupril. Quinapril hydrochloride is an angiotensin-converting enzyme, or ACE, inhibitor. Quinapril hydrochloride is used either alone or in combination with a thiazide diuretic for the treatment of hypertension. Serious side effects of quinapril use may include hypertensive crisis, rhythm disturbances, cardiogenic shock, gastrointestinal hemorrhage, agranulocytosis, angioedema of the lips, tongue, glottis, and larynx, acute renal failure, and possibly fatal severe heart failure. Ramipril. Ramipril is also available under the brand name Altase. Ramipril is an angiotensin-converting enzyme inhibitor. Ramipril is used either alone or in combination with other antihypertensive agents for the treatment of hypertension. Serious side effects may include myocardial infarction, stroke, arrhythmia, and bronchospasm. Amlodipine and atorvastatin. In combination, they are known under the brand name Caduet. Caduet is the first medicine to treat two different conditions at once, high blood pressure and high cholesterol. Caduet is indicated for the treatment of hypertension, chronic stable angina and vasospastic angina, and Prinzmetal's or variant angina. It is also indicated for primary dis-beta lipoproteinemia, elevated serum TG levels, hypercholesterolemia, and mixed dyslipidemia. Caduet is indicated also as an adjunct to diet to reduce total cholesterol, HDL and LDL, and apo-beta lipoprotein levels in boys and postmenarchal girls 10 to 17 years of age with heterozygous familial hypercholesterolemia. Side effects may include headache, abdominal pain, rash, chest pain, nausea, insomnia, and dizziness. Ambrisentan. Ambrisentan is also known under the brand name Letairis. Ambrisentan is a potent type A selective endothelin receptor antagonist. Endothelin is a peptide made by the body in the endothelial cells. Endothelin constricts blood vessels and elevates blood pressure. Endothelin receptor antagonists are a class of drugs which prevent the constriction or narrowing of blood vessels, thereby enhancing blood flow throughout the body. Endothelin is specifically indicated for the treatment of pulmonary arterial hypertension in subjects with World Health Organization Class 2 or 3 symptoms to improve exercise capacity and delay clinical worsening. Side effects may include peripheral edema, nasal congestion, sinusitis, flushing, palpitations, nasopharyngitis, abdominal pain, or constipation. Aliskiren. Aliskiren is also known under the brand name Tecturna. It is an orally active, non-peptide potent renin inhibitor. Aliskiren is the enzyme at the beginning of the renin-angiotensin system, one of the key regulators of blood pressure. Suppression of the renin-angiotensin system has been shown to lower hypertension and reduce cardiovascular events. Aliskiren is specifically indicated for the treatment of hypertension. It may be used alone or in combination with other antihypertensive agents. The use of aliskiren with maximal doses of ACE inhibitors has not been adequately studied. Side effects include hand, face, and/or body edema, diarrhea, abdominal pain, dyspepsia, gastroesophageal reflux, rash, elevated uric acid, gout, and renal stones. Welcome to the chapter on anti-Parkinson agents. Anti-Parkinson agents are used in the treatment of Parkinson's disease. The most commonly used anti-Parkinson agents act either on the dopaminergic system in the striatum and basal ganglia or are centrally acting muscarinic antagonists. Here's an overview of anti-Parkinson agents. Selegiline hydrochloride. Selegiline hydrochloride is available under the brand name Eldepril. Selegiline hydrochloride is an anti-Parkinson agent. It is administered in capsule form. Selegiline hydrochloride is used as an adjunct in the treatment of Parkinson's disease in patients who are being treated with levodopa and/or carbidopa and who have manifested a decreased response to therapy. The precise mechanism of action is not known. However, selegiline does inhibit MAO type B and may act through other mechanisms to increase dopaminergic activity. The side effects of selegiline use include dizziness, fainting, confusion, hallucinations, vivid dreams and nightmares, headache, anxiety, drowsiness, depression, mood changes, delusions, fatigue, disorientation, apathy, malaise, vertigo, overstimulation, sleep disturbance, transient irritability, weakness, lethargy, and personality change. Physical side effects may include tremors, chorea, loss of balance, blepharospasm, restlessness, bradykinesia, facial grimace, dystonic symptoms, tardive dyskinesia, involuntary movements, muscle cramps, heavy leg, falling down, stiff neck, freezing, festination, slow urination, urinary hesitancy or retention, prostatic hypertrophy, urinary frequency, and increased apraxia. Benztropine mesylate. Benztropine mesylate is also available under the brand name Cogentin. Benztropine mesylate is a synthetic anticholinergic and anti-Parkinson agent. It is used as an adjunct in the treatment of all forms of Parkinsonism. Benztropine mesylate is also used to reduce the severity of extrapyramidal effects in phenothiazine or other antipsychotic drug therapy. Benztropine mesylate is administered both in tablets and intravenously. Trihexafenadiol hydrochloride. Trihexafenadiol hydrochloride is also available under the brand name Artane. Trihexafenadiol hydrochloride is an anti-Parkinson agent and anticholinergic that causes a direct antispasmodic effect on smooth muscle and which relieves rigidity in cases of Parkinsonism. Trihexafenadiol hydrochloride is available in tablet or elixir. It is used primarily as an adjunct in the treatment of all forms of Parkinsonism. Side effects of trifenadil use may include serious central nervous system stimulation, which may result in restlessness, insomnia, delirium and agitation, as well as psychotic manifestations. Carbidopa. Carbidopa is also available under the brand name Lodicin. Carbidopa is an anti-Parkinson agent which inhibits peripheral decarboxylation of levodopa. Carbidopa does not inhibit central decarboxylation, which allows more levodopa to be available for transport to the brain. There, the levodopa is converted to dopamine, relieving the symptoms of Parkinsonism. Carbidopa is used in the treatment of all forms of Parkinsonism. Side effects of carbidopa use may include dyskinesias at lower doses. Patients who abruptly withdraw from levodopa while using carbidopa may experience neuroleptic malignant-like syndrome, including symptoms of muscular rigidity, hyperthermia, increased serum phosphokinase, and changes in mental status. Bromocriptine mesylate. Bromocriptine mesylate is also available under the brand name Parlodel. Bromocriptine mesylate is an anti-Parkinson agent and prolactin secretion inhibitor. Bromocriptine mesylate inhibits the release of the hormone prolactin by the pituitary. Bromocriptine mesylate is administered in capsules or tablets. It is used in the short-term treatment of amenorrhea with or without galactorrhea, infertility, or hypogonadism. Bromocriptine mesylate is also used either alone or as an adjunct in the treatment of acromegaly and as an adjunctive therapy with levodopa in the treatment of idiopathic or post-encephalitic Parkinson's disease. The type and incidence of bromocriptine side effects depend on the use of the drug. When used for hyperprolactinemia, Gastrointestinal side effects may include abdominal cramps, diarrhea, and constipation. Other side effects may include headache, nasal congestion, hypotension, dizziness, fatigue, drowsiness, lightheadedness, and psychoses. When used for treating acromegaly, the gastrointestinal side effects of bromocriptine use may include anorexia, dry mouth, dyspepsia, indigestion, and gastrointestinal bleeding. Other side effects may include dizziness, syncope, drowsiness, fatigue, headache, lightheadedness, lassitude, vertigo, sluggishness, paranoia, insomnia, heavy-headedness, decreased sleep requirement, delusional psychoses, visual hallucinations, orthostatic hypotension, digital vasospasm known as Raynaud syndrome, and in rare cases, arrhythmias, ventricular tachycardia, bradycardia, or vasovagal attack. When used for Parkinsonism, the side effects of bromocriptine use may include abdominal discomfort, constipation, anorexia, dry mouth, dysphagia, confusion, hallucinations, fainting, drowsiness, dizziness, insomnia, depression, vertigo, anxiety, fatigue, headache, lethargy, nightmares, urinary incontinence, urinary retention, urinary frequency, abnormal involuntary movements, asthenia, visual disturbances, ataxia, hypotension, edema of the feet and ankles, blepharospasm, erythromelalgia, skin mottling, nasal stuffiness, paresthesia, and skin rash. Pergolide mesylate. Pergolide mesylate is also available under the brand name Permax. Pergolide mesylate is a potent dopamine receptor agonist. Pergolide mesylate may act by directly stimulating postsynaptic dopamine receptors in the nigrostriatal system. This relieves symptoms of Parkinsonism. Pergolide mesylate is administered in tablets. The most common side effects of pergolide use include postural hypotension, palpitation, vasodilation, syncope, arrhythmias, nausea, hallucinations, anxiety, tremor, abnormal dreams, psychoses, personality disorder, extrapyramidal syndrome, speech disorders, rash, abnormal vision, urinary tract infection, chest pain, abdominal, neck, or backache, headache, flu syndrome, infection, peripheral edema, anemia, and weight gain. Procyclidine hydrochloride. Procyclidine is also available under the brand name Camadrin. Procyclidine is a synthetic anticholinergic anti-Parkinson agent. Procyclidine is used in the treatment of all types of Parkinsonism and in treating drug-induced extrapyramidal symptoms. Levodopa. Levodopa is also available under the brand names Dopar, Larodopa, and L-Dopa. Levodopa is an anti-Parkinson agent which is used to treat cases of idiopathic, arteriosclerotic, and post-encephalitic Parkinsonism resulting from carbon monoxide or manganese intoxication. In the elderly, this is associated with cerebral arteriosclerosis. The side effects of levodopa are numerous and usually dose-related. Central nervous system side effects may include choreiform or dystonic movements, paranoid ideation, psychotic episodes, depression, suicidal tendencies, hallucinations or delusions, euphoria, and, in rare cases, seizures. Gastrointestinal side effects may include abdominal pain, sialorrhea, dysphagia, dysgeusia, burning sensation of the tongue, and, in rare cases, gastrointestinal bleeding and duodenal ulcer. Cardiovascular side effects include cardiac irregularities, palpitations, orthostatic hypotension, hypertension, phlebitis, and hot flashes. Ophthalmologic side effects include diplopia, dilated pupils, development of Horner's syndrome, and oculogyric crises. Apomorphine hydrochloride. Apomorphine hydrochloride is also known under the brand name Apokin. Apomorphine is a non-ergoline dopamine agonist. Apomorphine is indicated for the treatment of motor symptoms associated with late-stage Parkinson's disease. Apomorphine is specifically indicated for the acute, intermittent treatment of hypomobility episodes. These episodes are also called, quote, end-of-dose wearing off and unpredictable on-off episodes, unquote. These episodes are associated with advanced Parkinson's disease. Apomorphine is also used as an adjunct or supplemental therapy to standard levodopa therapy. Side effects include yawning, dyskinesias, drowsiness, dizziness, postural hypotension, rhinorrhea, hallucinations, edema, and inflammation. In addition, apomorphine has been associated with a very high incidence of mild to moderate treatment-responsive nausea and vomiting, especially early in the treatment while the subject is still acclimating to apoquin. It is recommended that subjects begin antiemetic treatment with or just prior to treatment with apoquin and continue for as long as needed. Rivastigmine tartrate. Rivastigmine tartrate is also known under the brand name Exelon. Rivastigmine tartrate is a cholinesterase inhibitor. The exact mechanism of rivastigmine's action is unknown. However, rivastigmine tartrate is thought to exert its therapeutic effect by enhancing cholinergic function. Rivastigmine tartrate inhibits the cholinesterase enzyme from breaking down acetylcholine. It increases both the level and duration of action of the neurotransmitter acetylcholine. Rivastigmine tartrate is specifically indicated for the treatment of mild to moderate dementia of the Alzheimer's type and for the treatment of mild to moderate dementia associated with Parkinson's disease. Side effects include nausea, vomiting, diarrhea, depression, headache, anxiety, anorexia, and weight loss. Rotigotine. Rotigotine is also known under the brand name Nupro. Rotigotine is a non-ergolinic dopamine agonist which acts continuously over a 24-hour period. The exact mechanism of action of rotigotine in the treatment of Parkinson's disease is unknown. Rotigotine is specifically indicated for the treatment of the signs and symptoms of early-stage idiopathic Parkinson's disease. Side effects include somnolence, nausea, application site reactions, dizziness, headache, fatigue, extremity edema, and insomnia. Welcome to the section on antipsychotics. Antipsychotics are drugs that are effective in the treatment of psychoses. Psychosis is characterized by a gross impairment in reality testing as evidenced by delusions, hallucinations, markedly incoherent speech, or disorganized and agitated behavior. The patient does not have apparent awareness of the incomprehensibility of his behavior. Here's an overview of antipsychotics. Chlorpromazine hydrochloride. Chlorpromazine hydrochloride is also available under the brand name Thorazine. Chlorpromazine hydrochloride is a dimethylamino-type phenothiazine antipsychotic. Chlorpromazine hydrochloride is used in the treatment of both acute and chronic psychoses, including schizophrenia and the manic phase of manic depressive illness. The next drug is clozapine. Clozapine is also available under the brand name Clozaril. Clozapine is an antipsychotic which interferes with the binding of dopamine to both D1 and D2 receptors. Clozapine is primarily used in the treatment of severe schizophrenic patients who do not respond adequately to conventional antipsychotic therapy. Side effects of clozapine use may include seizures, drowsiness, sedation, confusion, rigidity, fatigue, epileptiform movements, orthostatic hypotension, cardiac abnormalities, muscle rigidity, altered mental status, irregular pulse or blood pressure, abdominal discomfort, pain of the back, legs, and neck, muscle spasm, muscle ache, visual disturbance, transient fever, rash, weight gain, and numbness or soreness of the tongue. Lithium carbonate. Lithium is also available under the brand names Lithobid and Lithonate. Lithium is an antipsychotic agent used for the control of mania in manic depressive patients. Side effects of lithium use may include fine hand tremor, polyuria, transient and mild nausea, general discomfort, arrhythmia, hypotension, sinus node dysfunction with severe bradycardia causing syncope, reversible flattening, isoelectricity or inversion of the T waves, blackout spells, epileptiform seizures, slurred speech, psychomotor retardation, hallucinations, cog-wheel rigidity, and tongue movements. Loxapine hydrochloride. Loxapine is also available under the brand name Loxetane. Loxapine is a tricyclic antipsychotic. Loxapine causes significant extrapyramidal symptoms, moderate sedative effects, and a low incidence of anticholinergic effects, as well as orthostatic hypotension. Loxapine is believed to act by blocking dopamine at the postsynaptic brain receptors. Loxapine is used in the treatment of psychotic disorders. Side effects of loxapine use may include tachycardia, hypertension, hypotension, lightheadedness, and syncope. Olanzapine. Olanzapine is also available under the brand name Zyprexa. Olanzapine is used in the management of psychotic disorders. Neuroleptic malignant syndrome, acute renal failure, rectal hemorrhage, heart arrest, and death are among the serious side effects of olanzapine use. Risperidone. Risperidone is also available under the brand name Risperdal. Risperidone is an antipsychotic. Serious side effects of risperidone use may include neuroleptic malignant syndrome, acute renal failure, torsade de pointes, AV block, myocardial infarction, and vaginal hemorrhage. Thioridazine hydrochloride. Thioridazine hydrochloride is also available under the brand name Melaril. Piperidine-type phenothiazide antipsychotic. Thioridazine hydrochloride is used in the management of psychotic disorders. Thiothiazine. Thiothiazine is also available under the brand name Navaine. Thiothiazine is an antipsychotic used in the symptomatic treatment of psychotic disorders. Side effects may include drowsiness, extrapyramidal symptoms, persistent tardive dyskinesia, cholestatic jaundice, orthostatic hypotension, tachycardia, blurred vision, moderate breast enlargement in women, neuroleptic malignant syndrome, polydipsia, peripheral edema, fine lenticular pigmentation, and in rare cases, anaphylaxis. Trifluoperazine. Trifluoperazine is also available under the brand name Stelazine. Trifluoperazine is a piperazine-type phenothiazine antiemetic antipsychotic. Trifluoperazine is used to manage psychotic disorders. It is also suitable for patients with apathy or withdrawal and for short-term treatment of non-psychotic anxiety. Droperidol. Droperidol is also available under the brand name Inapsine. Droperidol is a butyrophenone antipsychotic and anti-anxiety agent. Droperidol causes sedation, alpha-adrenergic blockade, peripheral vascular dilation, and has antiemetic properties. Droperidol is used preoperatively for the induction and maintenance of anesthesia. Side effects include postoperative drowsiness, restlessness, hyperactivity, anxiety, dizziness, postoperative hallucinations, extrapyramidal symptoms, hypotension and tachycardia, increase in blood pressure when combined with fentanyl or other parenteral analgesics, respiratory depression when combined with fentanyl, laryngospasm, bronchospasm, chills, and shivering. Flufenazine decanoate. Flufenazine is also available under the brand name Modicate, Decanoate, and Prolixine decanoate. Flufenazine is a piperazine-type phenothiazine antipsychotic. Flufenazine has a high incidence of extrapyramidal symptoms and a low incidence of sedation, anticholinergic effects, antiemetic effects, and orthostatic hypotension. Flufenazine is used in the treatment of psychotic disorders and as an adjunct to tricyclic antidepressants for chronic pain states. Flufenazine is administered via elixir, oral solution, and tablets. Haloperidol. Haloperidol is also available under the brand name Haldol. Haloperidol is a butyrophenone antipsychotic. Haloperidol is used in the treatment of psychotic disorders including manic states, drug-induced psychoses, and schizophrenia. Side effects may include extrapyramidal symptoms, particularly akathisia and dystonia. Perfenazine. Perfenazine is also available under the brand name Trilofan. Perfenazine is a piperazine-type phenothiazine antipsychotic. It has antiemetic effect as well. Perfenazine has a high incidence of extrapyramidal effects, strong antiemetic effects, and moderate anticholinergic effects. Perfenazine has a low incidence of orthostatic hypotension and sedation. Paliperidone. Paliperidone is also known under the brand name Invega. Paliperidone is an oral, extended-release, major active metabolite of risperidone. Paliperidone is an antagonist and thus interferes with neurotransmitter communication in the brain. Paliperidone blocks dopamine type 2, serotonin type 2, and alpha-2 adrenergic receptors, all of which have been implicated in schizophrenia. Paliperidone is specifically indicated for the treatment of schizophrenia. Side effects include Parkinsonism, akathisia, dyskinesia, tachycardia, headache, somnolence, anxiety, hyperkinesia, extrapyramidal disorder, and dystonia. Welcome to the section on antivirals. Antivirals are drugs which stimulate cellular defenses against viruses. This reduces cell DNA synthesis and makes cells more resistant to viral genes. This enhances cellular immune responses or suppresses their replication. The first drug in this category is Foscarnet sodium. Foscarnet sodium is also available under the brand name Foscavir. Foscarnet sodium is an antiviral agent. It inhibits the replication of all known herpes viruses by selective inhibition at the pyrophosphate binding site on virus-specific DNA polymerases. Foscarnet is used in the treatment of CMV retinitis in patients with AIDS. Foscarnet sodium is also used in the treatment of acyclovir-resistant HSV infections in immunocompromised patients. Renal impairment is the most common side effect of Foscarnet use. Didanosine. Didanosine is also available under the brand name Videx. Didanosine is an antiviral drug. It is primarily used in cases of advanced HIV infection in adult and pediatric patients who are either intolerant to AZT therapy or have demonstrated decreased effectiveness to AZT therapy. Pancreatitis and peripheral neuropathy are the most common side effects of didanosine use. Lamivudine. Lamivudine is also available under the brand name Epivir. Lamivudine is a nucleoside analog antiviral drug. Lamivudine is used in combination with AZT for the treatment of HIV infection. Side effects of lamivudine include diarrhea, anorexia or decreased appetite, abdominal pain or cramps, severe hepatomegaly with steatosis, pancreatitis, post-treatment worsening of hepatitis, neuropathy, insomnia or other sleep disorders, depressive disorders, peripheral neuropathies, musculoskeletal pain, myalgia, fatigue, fever or chills, skin rashes, and weakness. Zidovudine. Zidovudine is also called azidothybidine, or AZT, and is also available under the brand name Retrovir. Zidovudine is used in the initial treatment of HIV-infected adults who have a CD4 cell count of 500 milliliters or less. The active form of the drug is AZT triphosphate, which is derived from AZT by cellular enzymes. Known side effects of zidovudine include severe anemia, fever, diaphoresis, malaise, body odor, chills, edema of the lips, flu-like syndrome, hyperalgesia, abdominal, chest and back pain, lymphadenopathy, nausea, gastrointestinal pain, edema of the tongue, eructation, bleeding gums or mouth ulcers, rectal hemorrhage, somnolence, anxiety, and emotional lability. Indinavir sulfate. Indinavir sulfate is an antiviral drug and protease inhibitor. Indinavir sulfate binds to active sites on the HIV protease enzyme, resulting in inhibition of enzyme activity. Indinavir is used in the treatment of HIV infection in cases where antiretroviral therapy is indicated. Serious side effects of indinavir use may include acid regurgitation, jaundice, liver cirrhosis, neurotic disorder, peripheral neuropathy, sleep disorder, cardiovascular disorder and palpitations, musculoskeletal pain, respiratory failure, skin disorder, skin infection, sweating, and urticaria. Ritonavir. Ritonavir is an antiviral protease inhibitor. Ritonavir can be used either alone or in combination with the nucleoside analogs such as DDC or AZT for the treatment of HIV infection. Side effects of ritonavir use include diarrhea, taste alteration, anorexia, abdominal pain, dyspepsia, local throat irritation, circumoral paresthesia, peripheral paresthesia, dizziness, insomnia, paresthesia, somnolence, dementia, asthenia, headache, malaise, fever, sweating, rash, vasodilatation, hyperlipidemia, myalgia, and pharyngitis. Sequinavir mesylate. Sequinavir mesylate is an antiviral drug and protease inhibitor. Sequinavir mesylate is usually combined with AZT or zalcitabine, called DDC, for treatment of advanced HIV infection. Sequinavir is administered in both Invirase and Fortovase capsules. Interferon alpha-Con 1. Interferon alpha-Con 1 is also available under the brand name Infergen. Interferon alpha-Gen 1 is a drug prepared by recombinant technology for the treatment of chronic hepatitis. Interferon alpha-con 1 has antiviral, antiproliferative, and immunomodulatory effects. Side effects of interferon alpha-con 1 use may include flu-like symptoms, urticaria, angioedema, bronchoconstriction, amnesia, hypoesthesia, emotional lability, abdominal pain, tender liver, hypertension, palpitation, respiratory tract congestion, rash, back, limb, neck, or skeletal pain, dysmenorrhea, and vaginitis. Acyclovir. Acyclovir is also available under the brand name Zovirax. Acyclovir is an antiviral anti-infective. It is used as a treatment for both initial and recurrent genital herpes in immunocompromised and non-immunocompromised patients. Acyclovir is also used as treatment for chickenpox in children and herpes zoster, also known as shingles, in adults. Side effects of acyclovir use may include diarrhea, anorexia, sore throat, headache, dizziness, fatigue, edema, skin rashes, leg pain, and inguinal lymphadenopathy. Ganciclovir sodium. Ganciclovir sodium is also available under the brand name Cytovine. Ganciclovir sodium is an antiviral drug used intravenously. Ganciclovir sodium is used in the treatment of immunocompromised patients with CMV retinitis, such as AIDS patients. Fever is the most common side effect of ganciclovir use. Ribavirin. Ribavirin is also available under the brand name Virazole. Ribavirin is an antiviral agent and is used primarily in treating hospitalized pediatric patients, including infants with severe lower respiratory tract infections such as viral pneumonia and bronchiolitis due to RSV. Ribavirin is administered via aerosol only. In the cases involving infants, ribavirin is administered via an infant oxygen hood using a small particle aerosol generator 2, otherwise known as SPAG-2. Side effects of ribavirin use may include a worsening of respiratory status, pneumothorax, apnea, bacterial pneumonia, dependence on the ventilator, manifestations of digitalis toxicity, bradycardia, bigeminy, reticulocytosis, conjunctivitis, and rash. Vidarabine. Vidarabine is also available under the brand name Vira-A. Vidarabine is an antiviral and is used in the treatment of acute keratoconjunctivitis and recurrent epithelial keratitis. Vidarabine is more generally effective than idoxuridine for deep recurrent infections. Side effects of vidarabine use may include photophobia, lacrimation, conjunctival infection, foreign body sensation, temporal visual haze, burning, irritation, superficial punctate keratitis, pain, punctal occlusion, and sensitivity to bright light. Amantadine hydrochloride. Amantadine hydrochloride is also available under the brand name Simitrel. Amantadine hydrochloride is an antiviral and anti-Parkinson agent. Amantadine hydrochloride is used in the treatment of influenza A viral infections of the respiratory tract. Side effects may include constipation, anorexia, xerostomia, depression, psychosis, convulsions, hallucinations, lightheadedness, confusion, ataxia, irritability, anxiety, headache, dizziness, fatigue, and insomnia, peripheral edema, urinary retention, leukopenia, neutropenia, mottling of the skin of the extremities due to poor peripheral circulation, skin rash, visual problems, slurred speech, oculogyric episodes, dyspnea, weakness, and eczematoid dermatitis. Fosamprenavir calcium. Fosamprenavir calcium is also known as Lexiva. Fosamprenavir calcium is a new protease inhibitor for the treatment of HIV infection. It is a prodrug of amprenavir, an inhibitor of HIV protease. Fosamprenavir is rapidly converted to amprenavir, an inhibitor of HIV-1 protease, by cellular phosphatases in vivo. Amprenavir binds to the active site of HIV-1 protease, preventing the processing of viral GAG and GAG pol polyprotein precursors. This results in the formation of immature, non-infectious viral particles. Lexiva is indicated for the treatment of HIV infection in adults in combination with other antiretroviral agents. Side effects may include diarrhea, vomiting, headache, and rash. Tripranavir. Tripranavir is also known under the brand name Aptivus. Tripranavir is a non-peptide protease inhibitor. The drug disrupts the formation of mature viral particles by disrupting synthesis of viral proteins. Typrinavir is specifically indicated as a combination therapy with the approved drug ritonavir for the treatment of HIV-1 infected adult patients with evidence of viral replication. Typrinavir is indicated as a second-line or later therapy for use in patients who are highly treatment experienced or whose HIV-1 strain has shown resistance to other protease inhibitors. Side effects include anemia, neutropenia, pancreatitis, pyrexia, hepatic failure, anorexia, peripheral neuropathy, lipoatrophy, diarrhea, nausea, fatigue, and headache. Welcome to the section on blocking agents. Blocking agents are a class of drug that inhibit a specific biologic activity or process, such as axonal conduction or transmission, or ions across a cell membrane. Blocking agents are frequently referred to as blockers. Here's an overview of blocking agents. The first drug in this category is phenoxybenzamine hydrochloride. Phenoxybenzamine hydrochloride is also available under the brand name dibenzoline. Phenoxybenzamine hydrochloride is an alpha-adrenergic blocking agent. It increases blood flow to the skin, mucosa, and abdominal viscera, and lowers blood pressure. Phenoxybenzamine is used to control hypertension and sweating in pheochromocytoma before surgery, when surgery is contraindicated, or in malignant pheochromocytoma. Due to adrenergic blockade, side effects of phenoxybenzamine use include meiosis, postural hypertension, tachycardia, nasal congestion, and inhibition of ejaculation. Other known side effects include drowsiness, fatigue, and gastrointestinal upset. The next drug is phentolamine mesylate. Phentolamine mesylate is also available under the brand name Regitine. Phentolamine mesylate is an alpha-adrenergic blocking agent. It competitively blocks adrenergic receptors. Both presynaptic receptors, called alpha-2, and postsynaptic receptors, called alpha-1, are blocked. This produces vasodilation and a decrease in peripheral resistance. Phentolamine mesylate is used in the prophylaxis or treatment of hypertension in pheochromocytoma resulting from stress or manipulation during surgery. The cardiovascular side effects of phentolamine mesylate use include acute and prolonged hypotension, tachycardia, cerebrovascular spasm, cerebrovascular occlusion, and arrhythmia. Other side effects include orthostatic hypotension, flushing, diarrhea, dizziness, weakness, and nasal stuffiness. Acebutolol hydrochloride. Acebutolol hydrochloride is a beta-adrenergic blocking agent which, at higher doses, inhibits beta-2 receptors. Acebutolol is administered in capsule form and is effective in the treatment of hypertension and premature ventricular contraction. The next drug is atenolol. Atenolol is available under the brand name Tenormin. Atenolol is a beta-adrenergic blocking agent. Atenolol is used in the treatment of hypertension, angina pectoris due to hypertension, coronary atherosclerosis, and acute myocardial infarction. The benefits of atenolol in treating prophylaxis of migraine, alcohol withdrawal syndrome, situational anxiety, and ventricular arrhythmias are currently being studied. Esmolol hydrochloride. Esmolol hydrochloride is available under the brand name Brevibloc. Esmolol hydrochloride is a beta-adrenergic blocking agent which inhibits the beta-1 receptors. Esmolol is used to treat supraventricular tachycardia, or arrhythmias, and sinus tachycardia. Dermatologic side effects of esmolol use include inflammation at the site of infusion, flushing, pallor, induration, erythema, burning, skin discoloration, and edema. Other side effects include urinary retention, midscapular pain, asthenia, and changes in taste. The next drug is metoprolol succinate. Metoprolol succinate is available under the brand name Lopressor. Metoprolol succinate is a beta-adrenergic blocking agent. Metoprolol succinate primarily exerts beta-1 adrenergic blocking activity, although at high doses, beta-2 receptors are blocked as well. Metoprolol is used in the treatment of hypertension, acute myocardial infarction in hemodynamically stable patients, and angina pectoris. Though there are no known side effects of metoprolol use, its safety and effectiveness have not been established in children. Metoprolol succinate should be used with caution in cases of impaired hepatic function and during lactation. Cartiolol hydrochloride. Cartiolol hydrochloride is available under the brand name Cartrol. Cartiolol hydrochloride is a beta-adrenergic blocking agent. It is both a beta-1 and beta-2 receptor blocker. Cartiolol hydrochloride has no membrane-stabilizing effect. However, cartiolol hydrochloride does have moderate intrinsic sympathomimetic effect and low lipid solubility. Cartiolol is primarily used in the treatment of hypertension. The benefits of cartiolol hydrochloride in reducing the frequency of anginal attacks is currently being studied. Cartiolol can also be administered via ophthalmic solution to be used either alone or with other drugs to lower intraocular pressure in chronic open-angle glaucoma and intraocular hypertension. The known side effects of cartiolol ophthalmic include transient irritation, burning, tearing, conjunctival hyperemia, edema, blurred or cloudy vision, photophobia, decreased night vision, ptosis, blepharoconjunctivitis, abnormal corneal staining, and corneal sensitivity. Nadolol. Nadolol is also available under the brand name CoreGuard. Nadolol is a beta-adrenergic blocking agent used in the treatment of hypertension and angina pectoris. The benefits of nadolol in the treatment of the following are being studied: migraine headaches, ventricular arrhythmias, aggressive behavior, tremors associated with lithium or Parkinsonism, antipsychotic-induced akathisia, rebleeding of esophageal varices, and situational anxiety. Pindolol. Pindolol is also available under the brand name Visken. Pindolol is a beta-adrenergic blocking agent. It manifests both beta-1 and beta-2 adrenergic blocking activity. Pindolol has significant intrinsic sympathomimetic effects. Pindolol also has minimal membrane-stabilizing activity and moderate lipid solubility. Pindolol is administered in tablet form and is primarily used in the treatment of hypertension. Timolol maleate. Timolol maleate is also available under the brand name Biocadren and Timoptic. Timolol maleate is an ophthalmic agent and beta-adrenergic blocking agent. Timolol maleate exerts both beta-1 and beta-2 adrenergic blocking activity. Timolol maleate has minimal sympathomimetic effects, direct myocardial depressant effects, or local anesthetic action. Timolol maleate does not cause pupillary constriction or night blindness. The mechanism of the protective effect in myocardial ischemia is not known. Timolol maleate is useful in tablet form for the treatment of hypertension. The ophthalmic solution called Timoptic is used to lower intraocular pressure in chronic open-angle glaucoma, selected cases of secondary glaucoma, ocular hypertension, and aphakic patients with glaucoma. Side effects of timolol maleate in ophthalmic solution use include ocular irritation and local hypersensitivity. Succinylcholine chloride. Succinylcholine chloride is also available under the brand names amectine and quercetin. Succinylcholine chloride excites skeletal muscle by combining with cholinergic receptors, preferentially to acetylcholine. Succinylcholine chloride prevents the muscle from contracting by prolonging the time during which the receptors at the neuromuscular junction cannot respond to acetylcholine. Succinyl chloride is primarily used as an adjunct to general anesthesia to facilitate endotracheal intubation and to induce relaxation of skeletal muscle during surgery or mechanical ventilation. Known side effects of succinylcholine chloride use include severe persistent respiratory depression or apnea, muscle fasciculation, postoperative muscle pain, fever, salivation, hyperkalemia, postoperative muscle pain, anaphylaxis, myoglobinemia, myoglobinuria, skin rashes, increased intraocular pressure, muscle fasciculation, myalgia, jaw rigidity, perioperative dreams in children, and rhabdomyolysis. Verapamil. Verapamil is also available under the brand name Kalane and Isoptin. Verapamil is a calcium channel blocking agent. It slows AV conduction and prolongs effective refractory period. Verapamil is used as treatment in cases of angina pectoris due to coronary artery spasm called Prinzmetal's variant, chronic stable angina, unstable angina such as pre-infarction and crescendo, and with digitalis to control rapid ventricular rate at rest. Verapamil is also used during stress in cases of chronic atrial flutter or atrial fibrillation. Verapamil is also used as prophylaxis of repetitive paroxysmal supraventricular tachycardia. Serious side effects of verapamil use may include premature ventricular contractions and tachycardia after IV use, peripheral and pulmonary edema, hypotension, abdominal discomfort or cramps, and hallucinations. IV verapamil may increase intracranial pressure in patients with supratentorial tumors at the time of induction of anesthesia. Atropine sulfate. Atropine sulfate is also available under the brand name Atropare. Atropine sulfate is a cholinergic blocking agent. Atropine sulfate is used as an adjunct in peptic ulcer treatment, irritable bowel syndrome, in the treatment of spastic disorders of the biliary tract, urologic disorders, and urinary incontinence. Atropine sulfate is used during anesthesia to control salivation and bronchial secretions. Side effects of atropine use include blurred vision, increased intraocular pressure, and contact dermatitis. Acebutolol hydrochloride. Acebutolol hydrochloride is a beta-adrenergic blocking agent used in the treatment of hypertension. Acebutolol hydrochloride is administered in capsules. Bepridyl hydrochloride. Bepridyl hydrochloride is an anti-anginal calcium channel blocking drug. It inhibits the transmembrane influx of calcium ions into cardiac and vascular smooth muscle. Bepridyl hydrochloride also increases the effective refractive period of the atria, AV node, His-Purkinje fibers, and ventricles. Bepridyl hydrochloride is used in the treatment of chronic stable angina in patients who have failed to respond to other anti-anginal medications or who are intolerant to such medications. Side effects of Bepridyl use may include the induction of serious new arrhythmias, sinus bradycardia, palpitations, gastrointestinal distress, depression, tremor, respiratory infection, fever, superinfection, rash, arthritis, blurred vision, impotence, and agranulocytosis. Labetalol hydrochloride. Labetalol hydrochloride is also available under the brand names Normodyne and Trandate. Labetalol hydrochloride is an alpha and beta-adrenergic blocking agent. It decreases blood pressure by blocking both the alpha and beta-adrenergic receptors. Labetalol hydrochloride is used in tablet form, either alone or in combination with other drugs to treat hypertension. Side effects of labetalol use may include diarrhea, cholestasis with or without jaundice, fatigue, drowsiness, paresthesias, headache, and in rare cases, syncope. Levobunolol hydrochloride. Levobunolol hydrochloride is also available under the brand name Betagan. Levobunolol hydrochloride is a beta-adrenergic blocking agent which is used to decrease intraocular pressure in chronic open-angle glaucoma or ocular hypertension. Side effects may include transient stinging and burning, decreased corneal sensitivity, blepharoconjunctivitis, urticaria, and pruritus. The next drug is mivacurium chloride. Mivacurium chloride is also available under the brand name Mivacron. Mivacurium chloride is a neuromuscular blocking agent. Mivacurium chloride competitively inhibits the action of acetylcholine on the motor end plate, resulting in the block of neuromuscular transmission. Mivacurium chloride is used primarily as an adjunct to general anesthesia to facilitate tracheal intubation and to provide relaxation of skeletal muscle during surgery or mechanical ventilation. Side effects may include prolonged neuromuscular blockade, muscle spasms, flushing of the face, neck, or chest, hypotension, tachycardia, bradycardia, cardiac arrhythmias, phlebitis, bronchospasm, wheezing, hypoxemia, rash, urticaria, erythema, dizziness, and reaction at the injection site. Nimodipine. Nimodipine is also available under the brand name Nimotop. Nimodipine is a calcium channel blocking agent. Nimodipine has a greater effect on cerebral arteries than arteries elsewhere in the body. Nimodipine is used to improve neurologic deficits resulting from spasm following subarachnoid hemorrhage from ruptured congenital intracranial aneurysms. Side effects may include hypotension, peripheral edema, tachycardia, bradycardia, palpitations, rebound vasospasm, hypertension, hematoma, diarrhea, gastrointestinal hemorrhage, vomiting, headache, depression, hepatitis, jaundice, thrombocytopenia, anemia, purpura, ecchymoses, rash, muscle pain or cramps, diaphoresis, wheezing, and hyponatremia. Pancuronium bromide. Pancuronium bromide is also available under the brand name Pavulon. It is a non-depolarizing neuromuscular blocking agent which is 5 times as potent as D-tubocurarine. Pancuronium bromide is used variously as an adjunct to anesthesia to produce relaxation of skeletal muscle and facilitate ET intubation. Pancuronium bromide is also used to facilitate management of patients undergoing mechanical ventilation. Side effects include apnea, respiratory insufficiency, salivation, skin rashes, hypersensitivity reactions. Penbutylol sulfate. Penbutylol sulfate is also available under the brand name Levitol. Penbutylol sulfate is a beta-adrenergic blocking agent used to treat mild to moderate cases of arterial hypertension. Pipercuronium bromide. Pipercuronium bromide is also available under the brand name Arduan. It is a non-depolarizing neuromuscular blocking agent which competes for cholinergic receptors at the motor end plate and is antagonized by acetylcholinesterase inhibitors. Pipercuronium bromide has no effect on consciousness, pain threshold, or cerebration, and therefore must be accompanied by adequate anesthesia. Pipercuronium is used as an adjunct to general anesthesia to provide relaxation of skeletal muscle during surgery and to foster skeletal muscle relaxation for endotracheal intubation. It is administered intravenously. Side effects may include muscle atrophy, difficult intubation, hypotension, bradycardia, hypertension, thrombosis, myocardial ischemia, atrial fibrillation, ventricular extrasystole, hyposthesia, depression, respiratory depression, hypoglycemia, increased creatinine, rash, urticaria, and anuria. Rocuronium bromide. Rocuronium bromide is also available under the brand name Zemuron. Rocuronium bromide is a neuromuscular blocking agent and generally used as an adjunct to general anesthesia to facilitate rapid sequence and routine tracheal intubation. Rocuronium bromide may also be used to relax the skeletal muscle during surgery or mechanical ventilation. Side effects may include arrhythmias, abnormal ECG, transient hypotension and hypertension, tachycardia, symptoms of asthma, rash, edema at the injection site, and pruritus. Sotalol hydrochloride. Sotalol hydrochloride is also available under the brand name Beta-Pace. Sotalol hydrochloride is a beta-adrenergic blocking agent and is used in the treatment of documented ventricular arrhythmias. Sotalol hydrochloride is also used in the reduction and delay of incidence of atrial fibrillation or flutter in those with normal sinus rhythm who have a recent history of severe or disabling symptoms. Side effects may include new or worsened ventricular arrhythmia and torsade de pointe. Tubocurarine chloride. Tubocurarine chloride is a non-depolarizing neuromuscular blocking agent. Tubocurarine chloride is used as a muscle relaxant during surgery or during the setting of fractures and dislocations. Side effects may include excessive secretion and circulatory collapse. Vercuronium bromide. Vercuronium bromide is also available under the brand name Norcuron. Vercuronium bromide is a non-depolarizing neuromuscular blocking agent and is used to induce skeletal muscle relaxation during surgery or mechanical ventilation. Vercuronium bromide may also be used to facilitate endotracheal intubation and may be used as an adjunct to general anesthesia. Side effects include moderate to severe skeletal muscle weakness and malignant hyperthermia. Doxycurium chloride. Doxycurium chloride is also available under the brand name Neuromax. Doxycurium chloride is a neuromuscular blocking agent which binds to cholinergic receptors on the motor end plate to block the action of acetylcholine. This results in a blockade of neuromuscular transmission. Doxycurium chloride is used as an adjunct to general anesthesia to provide skeletal muscle relaxation during surgery. Side effects include skeletal muscle weakness, profound and prolonged skeletal muscle paralysis, hypotension, flushing, ventricular fibrillation, myocardial infarction, wheezing, bronchospasm, urticaria, fever, and diplopia. Esmolol hydrochloride. Esmolol hydrochloride is also available under the brand name Brevibloc. Esmolol hydrochloride is a beta-adrenergic blocking agent. It preferentially inhibits beta-1 receptors. It is used in the treatment of supraventricular tachycardia, arrhythmias, and sinus tachycardia. Side effects may include inflammation at the site of infusion, flushing, pallor, induration, erythema, burning, skin discoloration, edema, urinary retention, midscapular pain, asthenia, and changes in taste. Felodipine. Felodipine is also available under the brand name Plendil. Felodipine is a calcium channel blocking agent. Felodipine can be used either alone or with other antihypertensives in the treatment of mild to moderate hypertension. Side effects include significant hypotension, syncope, angina pectoris, peripheral edema, palpitations, arrhythmias, tachycardia, anxiety, psychosis, hallucinations, muscle cramps, pain, inflammation, nausea, nasal and chest congestion, respiratory infection, sexual difficulties, urinary frequency or urgency, and dysuria. Pregabalin. Pregabalin is also known under the name Lyrica. Pregabalin is a modulator of voltage-gated calcium channels designed to affect neurological transmission in multiple systems. Pregabalin binds to the alpha-2 delta auxiliary subunit of voltage-gated calcium channels. Blockade of these channels has been shown to inhibit the calcium-dependent release of a number of neurotransmitters. It is specifically indicated for the treatment of neuropathic pain associated with diabetic peripheral neuropathy and postherpetic neuralgia. Pregabalin is also indicated as an adjunctive therapy for the treatment of adult patients with partial onset seizures. Side effects include dizziness, somnolence, peripheral edema, diplopia, dry mouth, tremor, abnormal thinking, infection, headache, pain, asthenia, ataxia, blurry vision, constipation, and edema. Use of pregabalin has been associated with creatinine kinase elevations, including mean maximum elevations of 60 UI. Use of pregabalin has also been associated with weight gain. Natalizumab. Natalizumab is also known under the brand name Tysabri. Natalizumab is a recombinant humanized IgG4K monoclonal antibody produced in murine myeloma cells. Multiple sclerosis is an autoimmune disease that damages and prevents the creation of tissues that protect nerves called myelin. This creates lesions or scar tissue known as sclerosis. Lesions are believed to occur when activated inflammatory cells cross the blood-brain barrier. Leukocyte migration involves interaction between adhesion molecules on inflammatory cells and their counterreceptors present on endothelial cells of the vessel wall. Natalizumab works by blocking the integrin molecule and preventing immune cells from migrating through blood vessels in the brain to areas of inflammation. However, the specific mechanism by which natalizumab exerts its effects in multiple sclerosis have not been fully defined. Natalizumab is indicated for the treatment of patients with relapsing forms of multiple sclerosis to reduce the frequency of clinical exacerbations. Side effects include infections, hypersensitivity reactions, depression, cholelithiasis, and urticaria. Welcome to the section on bronchodilators and antiasthmatics. Bronchodilators and antiasthmatics dilate the lumen of the airway to allow the unrestricted passage of air and to relieve the spasms of asthma. Here's an overview of bronchodilators and antiasthmatics. The first drug in this category is aminophylline. Aminophylline is also available under the brand name Trufilin. Aminophylline is a bronchodilator and is used in cases of neonatal apnea. Aminophylline is also used as a respiratory stimulant in Cheyne-Stokes respiration. The ethylene diamine in aminophylline may cause exfoliative dermatitis or urticaria. Cromolyn sodium. Cromolyn sodium is also available under the brand name Intal. Cromolyn is an anti-asthmatic and anti-allergic drug. It is used as a prophylactic and adjunct agent in the management of bronchial asthma. It is used in patients who have significant bronchodilator reversible component to their airway obstruction. Cromolyn is also used as a prophylaxis in exercise-induced bronchospasm and bronchospasm due to allergens, cold, dry air, or environmental pollutants. Side effects of cromolyn use may include severe bronchospasm, which may be associated with a precipitous fall in pulmonary function. Other side effects include cough, eosinophilic pneumonia, pharyngeal irritation, nasal congestion, wheezing, nasal stinging or sneezing, dizziness, drowsiness, headache, and in rare cases, laryngeal edema. Theophylline. Theophylline is an anti-asthmatic bronchodilator. It is used as a prophylaxis and treatment of bronchial asthma. Side effects may include cardiac arrhythmia, seizures, brain damage, life-threatening ventricular arrhythmias, and peripheral vascular collapse. Netochromyl sodium. Netochromyl sodium is also available under the brand name Tylade. Netochromyl sodium is an anti-asthmatic. It inhibits the release of various mediators from a variety of cell types associated with asthma. This drug is used as maintenance therapy in patients with mild to moderate cases of bronchial asthma. Side effects may include coughing, pharyngitis, rhinitis, increased sputum, bronchitis, dyspnea, bronchospasm, dyspepsia, abdominal pain, dry mouth, diarrhea, dizziness, dysphonia, rash, sensation of warmth, headache, chest pain, fatigue, arthritis, viral infection, and unpleasant taste. Zafirlukast. Zafirlukast is also available under the brand name Acolate. Zafirlukast is an anti-asthmatic used in the prophylaxis and chronic treatment of asthma. Side effects may include diarrhea, abdominal pain, dyspepsia, headache, dizziness, urticaria, angioedema, rash, infection, generalized pain, asthenia, accidental injury, myalgia, fever, back pain, and systemic eosinophilia with vasculitis consistent with Sjögren-Strauss syndrome. Xyluton. Xyluton is an anti-asthmatic leukotriene receptor inhibitor. Xyluton is used in the prophylaxis and chronic treatment of asthma in adults and children over 12 years of age. Side effects of Xyluton use may include dyspepsia, constipation, unspecified pain, abdominal or chest pain, asthenia, fever, myalgia, arthralgia, neck pain, urinary tract infection, vaginitis, conjunctivitis, hypertonia, lymphadenopathy, and pruritus. Tiotropium bromide. Tiotropium bromide is also known as Spiriva handihaler. Tiotropium is an antimuscarinic agent. It is administered through an inhalation device used to inhale the dry powder with tiotropium capsules. The capsule is pierced by the device, dispersing the drug into the airstream. Tiotropium is an antimuscarinic agent or anticholinergic with similar affinity to the subtypes of muscarinic receptors M1 to M5. The drug inhibits M3 receptors at smooth muscle sites, leading to bronchodilation. Tiotropium is indicated for the treatment of bronchospasm associated with chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. Side effects include dry mouth, arthritis, coughing, influenza-like symptoms, and sinusitis. Arformoterol tartrate. Arformoterol tartrate is a selective beta-2 adrenergic bronchodilator. Beta-2 receptors are the predominant adrenergic receptors in bronchial smooth muscle. They cause stimulation of intracellular adenyl cyclase, which in turn causes relaxation of the bronchial smooth muscle. Arformoterol tartrate is specifically indicated for the long-term, twice-daily maintenance treatment of bronchoconstriction in patients with chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. Side effects include chest pain, back pain, diarrhea, sinusitis, leg cramps, dyspnea, and rash. Welcome to the chapter on Central Nervous System or CNS stimulants. CNS stimulants are a loosely defined group of drugs. CNS stimulants work by a variety of mechanisms to increase behavioral alertness, agitation, or excitation. Amphetamine sulfate. Amphetamine sulfate is a central nervous system stimulant. It is used to treat attention deficit hyperactivity disorder in children. It is also used to treat narcolepsy in both children and adults. Loss of appetite is a known side effect of amphetamine sulfate use. Methamphetamine hydrochloride. Methamphetamine hydrochloride is available under the brand name Desoxin. Methamphetamine is an amphetamine-type central nervous system stimulant. Methamphetamine is used to treat attention deficit disorder in children over 6 years of age. Methamphetamine is sometimes recommended for the treatment of obesity. It is administered in tablet form. Methylphenidate hydrochloride. Methylphenidate is available under the brand name Ritalin. Methylphenidate is a central nervous system stimulant. It acts by blocking the reuptake mechanism of dopaminergic neurons. This decreases motor restlessness and increases attention span in children with attention deficit disorder. The drug is primarily used in cases of attention deficit disorder in children as part of an overall treatment regimen. The benefits of methylphenidate are being investigated for the following: treatment of depression in the elderly, cancer, post-stroke patients, and anesthesia-related hiccups. Side effects of methylphenidate use include palpitations, tachycardia, angina, arrhythmias, hyper or hypotension, cerebral arteritis or occlusion, nausea, hair loss, abnormal liver function, toxic psychoses, dyskinesia, Tourette syndrome, and psychological dependence. Telithromycin. Telithromycin is also known under the brand name Ketec. Telithromycin is a semi-synthetic antibacterial in the ketolide class. The antibacterial kills many of the types of bacteria that can infect the lungs and sinuses and has been found to treat these infections safely. The drug was designed to deliver targeted coverage in community-acquired upper and lower respiratory tract infection. Ketec tablets are indicated for the treatment of infections caused by the following. 1. Acute bacterial exacerbation of chronic bronchitis due to Streptococcus pneumonia, Haemophilus influenza, or Moraxella catarrhalis. 2. Acute bacterial sinusitis due to Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, or Staphylococcus aureus. And 3. Community-acquired pneumonia due to Streptococcus pneumonia. Side effects may include diarrhea, nausea, headache, dizziness, vomiting, loose stools, and dysgeusia. Lisdexamphetamine dimesylate. Lisdexamphetamine dimesylate is also known under the brand name Vyvanse. Lisdexamphetamine is a prodrug of dextroamphetamine. It works primarily by inducing the release of the neurotransmitters dopamine and norepinephrine from their storage areas in nerve terminals. Both of these transmitters contribute to maintaining alertness, increasing focus, and sustaining thought, effort, and motivation. Lisdexamphetamine is specifically indicated for the treatment of attention deficit hyperactive disorder in pediatric populations aged 6 to 12 years. Side effects include decreased appetite, insomnia, upper abdominal pain, headache, irritability, vomiting, decreased weight, nausea, and dry mouth. Welcome to the section on cholinergic agents. Cholinergic agents are drugs which are used for their actions on cholinergic systems. The term cholinergic agents are sometimes still used in the narrower sense of muscarinic agonist, although most modern texts discourage that usage. Here's an overview of cholinergic agents. Pilocarpine hydrochloride. Pilocarpine is a miotic, direct-acting cholinergic agent. Pilocarpine is used in the treatment of chronic simple glaucoma, chronic angle closure glaucoma, acute angle closure glaucoma, and pre- and post-operatively for intraocular tension control. Known side effects of the ophthalmic use of pilocarpine include eye pain, blurred or darkened vision, headaches, and painful brow. Use of pilocarpine in the ocular system has been known to cause conjunctival irritation, which may include mild erythema and a slight increase in mucus secretion upon initial use of the drug. Side effects of the oral use of the tablet form of pilocarpine include sweating, flushing, rash, pruritus, abdominal pain, hypertension, tachycardia, bradycardia, ECG abnormality, palpitations, and syncope. Bethanocol chloride. Bethanocol chloride is also available under the brand name Uracoline. Bethanocol chloride is a direct-acting parasympathomimetic. It directly stimulates cholinergic receptors, primarily muscarinic types. This results in stimulation of gastric motility, increases gastric tone, as well as stimulates the detrusor muscle of the urinary bladder. Bethanocol chloride is used in the treatment of postpartum and postoperative urinary retention and in cases of neurogenic atony of the bladder with urinary retention. The benefits of bethanocol chloride use in cases of reflux esophagitis in adults and gastroesophageal reflux in infants and children are currently being studied. Gastrointestinal side effects of bethanocol chloride use include salivation, gastrointestinal upset, involuntary defecation, cramps, and colic. Cardiovascular side effects include hypotension with reflex tachycardia. Other side effects include headache, malaise, sensation of heat about the face, sweating, urinary urgency, attacks of asthma, bronchial constriction, meiosis, and lacrimation. Welcome to the section on diuretics and loop diuretics. Diuretics are agents that promote the excretion of urine through their effects on kidney function. A loop diuretic is a class of diuretic agent which acts by inhibiting the reabsorption of sodium and chloride. A loop diuretic does this not only in the proximal and distal tubules, but also in Henle's loop. Here's an overview of diuretics and loop diuretics. Milleride hydrochloride. Amilleride hydrochloride is also available under the brand name Midamor. Amilleride is a potassium-sparing diuretic. It is primarily used as an adjunct with thiazides or loop diuretics in the treatment of hypertension or edema due to congestive heart failure, hepatic cirrhosis, and nephrotic syndrome to help restore normal serum potassium and prevent hypokalemia. Bumetanide. Bumetanide is also available under the brand name Bumex. Bumetanide is a loop diuretic. Bumetanide inhibits reabsorption of both sodium and chloride in the proximal tubule as well as the ascending loop of Henle. It is used to treat edema associated with congestive heart failure, nephrotic syndrome, and hepatic disease. Bumetanide may also be used as an adjunct to treat acute pulmonary edema. Side effects may include electrolyte and fluid changes, dehydration, electrolyte depletion, circulatory collapse, reversible and irreversible hearing impairment, vertigo with a sense of fullness in the ears, hypotension, chest pain, renal failure, arthritic pain, muscle cramps, fatigue, thrombocytopenia, hyperventilation, and pain following parenteral use. Chlorthiazide. Chlorthiazide is also available under the brand name Diuril. Chlorthiazide is a thiazide-type diuretic which can be administered via oral suspension, tablets, or intravenously. Side effects of chlorthiazide use may include hypotension, renal failure, renal dysfunction, and interstitial nephritis. Specific side effects following intravenous use may include alopecia, hematuria, exfoliative dermatitis, topic epidermal necrolysis, erythema multiforme, and Stevens-Johnson syndrome. Indapamide. Indapamide is also available under the brand name Lozol. Indapamide is a thiazide-type diuretic. It can be used either alone or in combination with other drugs for treatment of hypertension. Indapamide may also be used in the treatment of edema and congestive heart failure. Mannitol. Mannitol is also available under the brand name Osmitrol. Mannitol is an osmotic diuretic which increases the osmolarity of the glomerular filtrate. This decreases the reabsorption of water and increases excretion of sodium and chloride. Mannitol increases the osmolarity of the plasma, which leads to enhanced flow of water from tissues into the interstitial fluid and plasma. In this way, cerebral edema is decreased. Mannitol is used to treat or prevent the oliguric phase of acute renal failure before irreversible renal failure occurs. Mannitol is used to decrease intracranial pressure and cerebral edema by decreasing brain mass, to decrease elevated intraocular pressure when the pressure cannot be lowered by other means, and to promote urinary excretion of toxic substances. Mannitol may also be used as a urinary irrigant to prevent hemolysis and hemoglobin buildup during transurethral prostatic resection or other transurethral surgical procedures. Side effects may include fluid and electrolyte imbalance, acidosis, loss of electrolytes, dehydration, nausea, vomiting, dry mouth, thirst, diarrhea, edema, hypotension or hypertension, increase in heart rate, angina-like chest pain, congestive heart failure, thrombophlebitis, dizziness, headaches, blurred vision, seizures, pulmonary congestion, marked diuresis, rhinitis, chills, fever, urticaria, pain in the arms, and skin necrosis. The next drug is spironolactone. Spironolactone is also available under the brand name Aldactone. Spironolactone is a potassium-sparing diuretic. It acts on the distal tubule to inhibit sodium exchange for potassium, resulting in increased secretion of sodium in water and the conservation of potassium. Spironolactone acts as an aldosterone antagonist and manifests a slight antihypertensive effect. Spironolactone also interferes with the synthesis of testosterone. It may increase formation of estradiol from testosterone, thereby leading to endocrine abnormalities. Spironolactone is used to treat cases of primary hyperaldosteronism and edema in cases where other approaches are inadequate or ineffective. Spironolactone may also be used in the treatment of essential hypertension and the prophylaxis of hypokalemia in patients taking digitalis. Spironolactone is administered in tablet form. Side effects may include hyperkalemia, hyponatremia, diarrhea, cramps, ulcers, gastric bleeding, vomiting, lethargy, mental confusion, headache, gynecomastia, menstrual irregularities, impotence, bleeding in postmenopausal women, deepening of the voice, hirsutism, maculopapular or erythematous cutaneous eruptions, urticaria, drug fever, breast carcinoma, gynecomastia, hyperchloremic metabolic acidosis in hepatic cirrhosis, and agranulocytosis. Torsemide. Torsemide is also available under the brand name Demodex. Torsemide is a loop diuretic used to treat congestive heart failure, acute or chronic renal failure, hepatic cirrhosis, and hypertension. Side effects may include headache, dizziness, asthenia, insomnia, nervousness, syncope, diarrhea, constipation, nausea, dyspepsia, edema, gastrointestinal hemorrhage, rectal bleeding, ECG abnormality, chest pain, atrial fibrillation, hypotension, ventricular tachycardia, shunt thrombosis, rhinitis, increased cough, arthralgia, myalgia, sore throat, excessive urination, and rash. The next drug is triamterene. Triamterene is also available under the brand name Direnium. Triamterene is a potassium-sparing diuretic. Triamterene is used in the treatment of edema due to congestive heart failure, hepatic cirrhosis, nephrotic syndrome, steroid therapy, secondary hyperaldosteronism, and idiopathic edema. Side effects may include hyperkalemia, electrolyte imbalance, nausea, vomiting, diarrhea, dry mouth, dizziness, drowsiness, fatigue, weakness, headache, megaloblastic anemia, thrombocytopenia, azotemia, interstitial nephritis, anaphylaxis, photosensitivity, hypokalemia, jaundice, muscle cramps, and rash. The next drug is ethacrynate sodium. Ethacrynate sodium is a loop diuretic. It inhibits the reabsorption of sodium and chloride in the loop of Henle and decreases reabsorption of sodium and chloride. Ethacrynate also increases potassium excretion in the distal tubule. Ethacrynate also acts directly on the proximal tubule to enhance excretion of electrolytes. Ethacrynate is used in the treatment of congestive heart failure, acute pulmonary edema, edema associated with nephrotic syndrome, ascites due to idiopathic edema, lymphedema, and malignancy. Ethacrynate is administered intravenously. Side effects may include hypocalcemia, anorexia, vomiting, diarrhea, acute pancreatitis, abdominal discomfort or pain, jaundice, gastrointestinal bleeding or hemorrhage, dysphagia, severe neutropenia, thrombocytopenia, agranulocytosis, and in rare cases, Henoch-Schönlein purpura in patients with rheumatic heart disease. The next drug is furosemide. Furosemide is available under the brand name Lasix. Furosemide is a loop diuretic. Furosemide inhibits the reabsorption of sodium and chloride in the proximal and distal tubules as well as the ascending loop of Henle. This results in the excretion of sodium, chloride, and to a lesser degree potassium and bicarbonate ions. Furosemide is used in the treatment of edema associated with congestive heart failure, nephrotic syndrome, hepatic cirrhosis, and ascites. Side effects may include fluid and electrolyte depletion leading to dehydration, hypovolemia, thromboembolism, hyperuricemia, azotemia, hyponatremia, nausea, oral and gastric irritation, vomiting, anorexia, jaundice, ischemic hepatitis, hearing impairment, blurred vision, orthostatic hypotension, chronic aortitis, leukopenia, agranulocytosis, and in rare cases, aplastic anemia. Hydrochlorothiazide. Hydrochlorothiazide is also available under the brand name Ezide and Hydrodiaryl. Hydrochlorothiazide is a thiazide-type diuretic used in the treatment of hypertension. Side effects may include allergic myocarditis, hypotension, alopecia, exfoliative dermatitis, toxic epidermal necrolysis, erythema multiforme, Stevens-Johnson syndrome, anaphylactic reactions, and respiratory distress, including pneumonitis and pulmonary edema. Welcome to the section on hemostatics. Hemostatics are a class of drugs used to arrest the hemorrhage of blood. A hemorrhage is characterized by the escape of blood from the vessels, as in bleeding. Small hemorrhages are classified according to size. Here's an overview of how hemorrhages are classified. Petechia mean very small. Purpura means up to 1 centimeter. Ecchymoses means above 1 centimeter. The massive accumulation of blood within a tissue is called a hematoma. Here's an overview of hemostatics. The first drug in this category is antihemophilic factor. Antihemophilic factor is also known as factor VIII. Antihemophilic factor is a systemic hemostatic. Antihemophilic factor is used to control bleeding in patients suffering from hemophilia A. Side effects may include headache, somnolence, lethargy, fatigue, dizziness, increased bleeding tendency, flushing, slight hypotension, acute hemolytic anemia, and hyperfibrinogenemia. Factor IX complex human. Factor IX complex human is a systemic hemostatic used to prevent or control bleeding in patients with factor IX deficiency, specifically hemophilia B and Christmas disease. Side effects may include thrombosis, chills, and fever. Welcome to the section on hormones. Hormones are chemical substances which have a specific regulatory effect on the activity of certain organ or organs. The term was originally applied to substances secreted by various endocrine glands and transported in the bloodstream to the target organs. Now, the term hormone is extended to include substances that are not necessarily produced by the endocrine glands but have similar effects. Estrogen is a generic form for estrus-producing steroid compounds, the female sex hormones. In humans, estrogen is formed in the ovary, and sometimes in the adrenal cortex, the testes, and the fetoplacental unit. Estrogen has various functions in both sexes. Estrogen is responsible for the development of the female secondary sex characteristics. During the menstrual cycle, estrogen acts on the female genitalia to produce an environment suitable for the fertilization, implantation, and nutrition of the early embryo. Estrogen is used in oral contraceptives and is a palliative in cases of breast cancer after menopause as well as cancers of the prostate. Other uses of estrogen include the relief of discomforts of menopause, inhibition of lactation, and treatment of osteoporosis, threatened abortion, and various functional ovarian disorders. Antithyroids are a class of agents that suppress thyroid function. The thyroid is a butterfly-shaped endocrine gland found on both sides of the trachea. The thyroid secretes the hormone thyroxin. Thyroxin controls the rate of metabolism. Progesterone products are drugs or agents which are used as an antagonist of estrogen. Progesterone, which is produced in the corpus luteum, promotes the proliferation of uterine mucosa and the implantation of the blastocyst, thereby preventing further follicular development. Here's an overview of hormones. The first drug in this category is diethylstilbestrol diphosphate. Diethylstilbestrol diphosphate is also available under the brand name Stilfostrol. Diethylstilbestrol diphosphate is a non-steroidal synthetic estrogen. It competes with androgen receptors, preventing androgen from inducing further growth of the neoplasm. Diethylstilbestrol is used as a palliative treatment in cases of inoperable progressive prostatic cancer. Side effects of diethylstilbestrol use may include thrombophlebitis, pulmonary embolism, cerebral thrombosis, neuroocular lesions, anorexia, headaches, malaise, irritability, allergic rash, itching, gynecomastia, changes in libido, porphyria, backache, pain and sterile abscess at the injection site, and post-injection flare. The next drug is medroxyprogesterone acetate. Medroxyprogesterone acetate is also available under the brand name Depo-Provera C 150 and Provera. Medroxyprogesterone is a synthetic progestational hormone. It prevents stimulation of the endometrium by pituitary gonadotropins. Medroxyprogesterone is used in cases of secondary amenorrhea, abnormal uterine bleeding due to hormonal imbalance, and as an adjunct and palliative treatment of inoperable, recurrent, or metastatic endometrial or renal carcinoma. Medroxyprogesterone use may include amenorrhea or infertility for up to 18 months, thrombophlebitis, pulmonary embolism, nausea, jaundice, nervousness, drowsiness, insomnia, fatigue, dizziness, pruritus, urticaria, rash, acne, hirsutism, alopecia, angioneurotic edema, hyperpyrexia, anaphylaxis, decrease in glucose tolerance, weight gain, and fluid retention. The next drug is tamoxifen. Tamoxifen is also available under the brand name Nolvadex. Tamoxifen is an anti-estrogen. It is believed to compete with estrogen for estrogen binding sites in target tissue of the breast. Tamoxifen also blocks the uptake of estradiol. Tamoxifen is used in the adjuvant treatment of axillary node negative or node-positive breast cancer in women following total or segmental mastectomy, axillary dissection, and breast irradiation. The side effects of tamoxifen use may include a distaste for food, abdominal cramps, pulmonary embolism, depression, fatigue, cholestasis, hepatitis, hepatic necrosis, vaginal bleeding and discharge, altered menses, oligomenorrhea, ovarian cysts, hyperplasia of the uterus, musculoskeletal pain, mild to moderate thrombocytopenia and leukopenia, retinopathy, hair loss, fluid retention, and coughing. The next drug is methimazole. Methimazole is also available under the brand name Tapazole. Methimazole is an anti-thyroid drug. The onset of methimazole is more rapid but less consistently effective than that of propylthiouracil. Methimazole is administered in tablet form. Propylthiouracil. Propylthiouracil is also available under the brand name propylthiouracil. Propylthiouracil is an anti-thyroid preparation. It inhibits the production of thyroid hormones by the thyroid gland. Propylthiouracil prevents the incorporation of iodide into tyrosine and coupling of iodotyrosenes. Propylthiouracil is used in the treatment of hyperthyroidism,